Good morning, everyone. Today is Tuesday, July 26th. I am Montgomery County Council President Gabe Albornoz, and it is a pleasure to be with all of you this morning. We begin today with two wonderful presentations. The first is a commemoration of Maddie Stepanek Peace Day by Council Member Katz. Would everybody who is here for that please come forward in front of the dais? And Vice President Glass.
Well, good morning, everyone, and thank you for joining us. Today is, I guess I always like to say that every day is a special day in Montgomery County, but it's especially a special day because we're joined today by Jenny Stepanek. And today we are here to honor Maddie Stepanek. Every year on July 17th, which is Maddie's birthday, and Jenny is referred to as Mama Peace, and you just had a birthday too. Yes, there you go. And when I have a birthday, I start to look older. It didn't happen with you, but anyhow. But we do this every year on July 17th for Maddie's birthday. And we do that to celebrate Peace Day, a day to set apart to recognize the impact that Maddie had on our community and throughout the country, and really we could say throughout the world. As we honor Maddie with this proclamation that Vice President Glass and I are going to be doing, I'm reminded once again of how much we have to learn from his legacy. This year in particular, we've been thinking a great deal about the lessons he taught us about peace. His work as a young peace ambassador is more relevant today than ever. Although he was only with us for a brief 13 years, Maddie made a lasting impact. He was known as a best-selling author of a beautiful poetry and essays on peace. He encouraged us to understand that peace is about promoting respect and kindness, about choosing to be with our neighbors in nonviolent and non-judgmental ways. And we're fortunate to have Jenny with us today as well to share a few words about the life and legacy of her son. With that, I'm going to turn it over to Vice President Glass, who's going to turn it over to Jenny. Please, Evan.
Thank you, Councilmember Katz. Good morning, Jenny. It's good to see you again. Happy belated birthday. And this proclamation and Peace Day is also tied to Maddie's birthday. And for being just 13 years old, he was a wise soul. He was prophetic. And in looking at his readings and seeing his vision, it is a reminder that we need to continue reading his work. I encourage you to go to the Montgomery County Public Library site, go to his own organization's website, which I know Jenny will share more information about, because now more than ever we need to be reminded that we live in a beautiful community, a beautiful world, and we need to redouble our efforts to make sure that everybody feels welcome and safe and loved, and that we practice peace, not in a defensive way, but in an offensive way. Because that is the only way we can manifest the future that we want, and we need to continue sharing Maddie's vision. And it's a pleasure to have Jenny with us, who is continuing that legacy and is continuing his vision. So, Jenny, you want to come up, or I'll bring this? Here we go. Here we go.
Thank you. All right. So hi. So thank you, Councilmember Katz and Glass. I want to say Sydney and Evan, but I'm trying to be formal, okay? I just want to thank the County Council for year after year choosing to make peace something that matters. Very few people in our world would say, I don't want peace. We all want peace. And Maddie said peace is possible. And if we think about that, it sounds wonderful. But how do we make peace? How do we move from peace being possible to being a reality? And that's what Maddie did for us. Maddie took this abstract concept of peace and he broke it down into achievable, sustainable, replicable, motivational, like pathways to peace. He said no one person can end war, but every person can choose and begin peace. Every person can be kind. Every person can say, I'm angry, I'm frustrated, I don't understand, I disagree. but we still can tend to basic human needs. We can still celebrate what he called heart songs, which is our inner purpose. We can bring those heart songs together and rebuild what he called the mosaic of humanity. We can begin to get to know our neighbors at local and global levels, and that's what we do with Maddie's Foundation. Is we take all the messages of hope and peace that Maddie offered and we turn them into programs and activities and campaigns and things that help people understand, no, maybe I can't end war. And maybe I disagree with my neighbor. But how do I still choose peace? How do I be a part of cultivating peace and kindness? So I want to thank the county for always celebrating Maddie's birthday. Conveniently, which comes right before my birthday, so it's like a big deal, and 63 feels really good. Thank you. But I just want to thank them, and I want to encourage people, go to maddieonline.com, M-A-T-T-I-E. Go to maddieonline.com and just learn a little bit more about what we do. Reach out to me. Reach out. I'm very accessible, all right? I am my own people, okay? I am the president of the foundation. We do have a global board, but I respond personally, and I will help each individual person in this entire world figure out what is my purpose for peace. Thank you.
This is a proclamation from the County Council. Whereas Maddie J.T. Stepanek, born on July 17, 1990, was an American poet, an ambassador of goodwill, an advocate for peace, and all while living with a debilitating genetic neuromuscular disease that ultimately took his life on June 22, 2004, just before his 14th birthday, and
whereas by the age of 13, Maddie began celebrating hope and happiness by creating poetry referred to as heart songs, which are expressions of inner purpose that connect humanity in positive ways. And
Maddie spent his life inspiring millions of diverse global neighbors with his vision and mission of hope and peace, sharing it on television and speeches and in 7-time award-winning New York Times best-selling book of poetry and peace essays, while grieving the loss of his 3 siblings and facing his own health challenges. And
whereas Maddie believed that peace is possible, peace is for all people. Peace can be taught, and peace begins with deliberate choices in attitude and action, reminding us that, quote, we are a mosaic of gifts, and to remember to play and after every storm. And
Maddie encouraged us to understand that peace is not about having to agree with our neighbors, but choosing to be with their neighbors in nonviolent and non-judgmental ways, promoting respect and kindness. And
whereas to recognize and honor Maddie's contributions, in 2014, a congressional resolution was passed to support Maddie J.T. Stepanek Foundation's National Peace Day campaign to have Maddie's birthday annually proclaimed as a day to learn about and celebrate peace. And
to commemorate his life and legacy, a 26-acre namesake park and playground with a statue and peace garden was created in 2008 in his King Farm neighborhood, and the city of Rockville collaborates with Maddie's Foundation to annually celebrate Maddie's Peace Day in July. Now therefore it be resolved that the County Council of Montgomery County, Maryland hereby recognizes July 17th as Peace Day in honor of Maddie J.T. Stepanek's life and legacy of peace, which continues to gently shape our world with hope and goodwill. And it's signed today by Vice President Glass and myself. Congratulations. Thank you. Thank you. Could our colleagues please join our colleague, Jenny Stepanek, please?
And as I told everybody, I will bring the pen to the White House where the President on National Peace Day.
That was wonderful. Thank you so much. We certainly could use a lot more peace these days. Next, we will go on to a proclamation celebrating the 10th anniversary of the Montgomery County Food Council, presented by Councilmember Rice. Would everybody who's here for that proclamation please come forward?
Well, thank you very much, Mr. President, and I'm joined by some of my colleagues, and quite honestly, all of my colleagues need to be down here because this is something that matters to each and every one of us, and we fought so hard over the midst of this pandemic. So if my colleagues want to join me, please come on down. We're joined today by some of our Food Council members, including our Executive Director, Heather Bruskin, and Kim McBride, our Board Chair. We've got Anne Marie Hart, Bookbinder, Bezatena. We have Elizabeth Tuin. We have Daniel Zinn, Allison Schnitzer, Mike Houston, Sharon Strereth, Amanda Nesher, and Lucia Zagara. It takes so many people to really make sure that we feed a village, but you know, there's a quote that says, "Food is medicine, and let medicine be thy food." And I think that in the course of the pandemic, we realized, as we knew before, just how important food was, as so many people face food insecurity because of their jobs, instability, because of what we saw with the recession, and because we also saw them just how food impacted their health overall and their well-being, and then increased their susceptibility when it came to COVID. I am proud, along with my district council members, Councilmember Nancy Navarro and Councilmember Andrew Friedson, to represent our agricultural reserve. I just got back late last night from a national conference where we were talking about some of the importances and the things that we need to do to continue to stand up our farmers across these great United States, because we know how important food is for everyone. In fact, it's the reason why with great leaders like Heather Bruskin, we started the Farm Committee under the guise of COG. One of the things that Councilmember Navarro was a leader in terms of ensuring that we had this brand new committee that focuses on food resiliency in this Washington metropolitan area. Food is so important to us, and it's something that is the reason why our forefathers on the council decided to dedicate almost 100,000 acres of Montgomery County land to our agricultural reserve to ensure that we would have places where we would continue to grow healthy food for our community. And while somehow Montgomery County oftentimes is seen as this place where everybody prospers, the reality is that we have so many people each and every day in our community who go hungry, children who are looking for that meal. And I want to close by just saying this, that for our federal government partners, while we have a hunger summit that's about to happen this October, it is shameful for us to say that we're not going to continue something that we know is so important, which was ensuring that every child who goes to school has access to free meals, regardless of their income status. It should not matter. This is something that should be a core practice that we do, because we all know what hunger can do to the mind, and especially of our children, and it keeps them from being able to learn and effectively being able to prosper. So I want to just close by saying this: our Food Council are true leaders. They are crusaders. They are folks in our community who really go above and beyond to ensure that the things I just talked about are recognized. And I want to specifically call out Heather Bruskin for her regional leadership and vision, and engaging her supportive and amazing board and the hardworking and dedicated staff of the Food Council. We are nationally recognized for the great work that we do, and we're standing up this so that other people can see the great things that we have going on. So with that, I want to turn to some of my colleagues very briefly to make some remarks, and then we'll turn to the proclamation, and then Heather Bruskin. Councilmember Navarro.
Thank you, Councilmember Rice. We seem every day to face a different headline, and it seems like it's just never ending. And to me, when I reflect on the lessons, particularly of the pandemic early in 2020, and as it continue on throughout the past 1.5 years, the first thing that I believe all of us had to face was this issue of food insecurity. And even though we knew that this was a problem here in Montgomery County, notwithstanding how wealthy we are, the reality is the pandemic came once again to teach us another particular lesson and put it into focus. And we all remember those long lines that still exist, but particularly how crucial it was for all of us to come together very quickly. However, we would have not been able to respond appropriately if it had not been for the infrastructure that was already there, with leaders in the Food Council, with so many nonprofit organizations, with so many people who have been working on this issue before. And so our job was just to quickly enhance and leverage that. And this is what we did, but it's not over. As it just been described, this continues to be an issue. So it is important to highlight it. Again, it is so important that we also have this asset of the agricultural reserve, but we have to stay true to this, and we cannot forget the lessons that this pandemic has come to teach us, because I believe that this new way of addressing issues is going to require that kind of innovative leadership. And so I want to congratulate and thank everyone who brought us to this point and for everything that everyone is going to do moving forward. Thank you.
Thank you. Next, we'll hear from one of our other district council members representing the Ag Reserve, Councilmember Friedson.
Thank you so much to Councilmember Rice for having this recognition, to the Food Council for 10 extraordinary years. All the problems that we face in Montgomery County can be solved by the people in Montgomery County. The solutions are all around us, and that is not more true than in food. We have more than enough food to feed everybody in Montgomery County. The question is, do we have the connections? Do we have the partnerships? Do we bring people together enough to make sure that we don't leave anybody behind? And the Food Council has been at the forefront of making sure that we are connecting the assets and the people and the parts of our community to build the type of safety net that we want and expect. When we talk about the basic needs in life, food, shelter, and clothing, food comes first. It is the absolute most fundamental, most basic of basic needs. So I'm just so proud of everything that Heather Bruskin, the Food Council, have been able to do over the last 10 years. Really pleased with how we've been able to use that foundation to take it to all new levels, particularly during this pandemic when it was needed the most, and look forward to building from that foundation and making sure that we leave no family, we leave no child, we leave no person in Montgomery County behind, because as long as anybody in our community doesn't know where the next meal has come from, then we have not sufficiently done our job. And so thank you so much to the Food Council for everything that you continue to do and all the partnerships that you've been able to build in our community.
Thank you very much, Councilmember Friedson. And I want to give accolades to our prior council members who served with us when the Food Council was created. And our former county executive, Isaiah Leggett. So Councilmember Reamer, myself, now County Executive Elridge, Councilmember Navarro, we're all there when the Food Council was first created, and we were there at the front lines in terms of knowing that we needed to empower someone who was going to be fantastic to take us to that next level. I want to give an opportunity for any of my other colleagues, because I know they all care about food and care about hunger in our communities, and this is really important for them to say just a brief word before we turn it over to Heather Bruskin. I'll start with Councilmember Jawanda.
Thought you were turning to Heather, but okay. Heather, I asked her, I whispered, I said, how long have you been doing this? I said, have you been for the whole 10 years? Because it feels like, Heather and her team have been here. She said 8 of the 10, so close. I agree with my colleagues. This is such an important thing. We initiated a special appropriation at the beginning of the pandemic, $10 million to leverage our food to farm, our farm to tip food bank, our farm to table crops, our restaurants. And the only reason we were able to do it so quickly is because we had the Food Council. We had this great plan that we just need to put money behind to implement. And it has grown. Refrigeration trucks, they've been giving out grants to many nonprofits throughout the community. They've helped coordinate our effort. And it's just really, really an awesome entity. And I want to thank everyone behind who's played a huge role, because I know it's not just Heather, and I know she'll say that. The last thing I want to say is, it's been mentioned how important food is. But one of the things I love about the work of the Food Council is that they are focused on the whole ecosystem of how to create sustainability throughout and how to make sure that people have food and that they have it in a dignified way. We had to meet the needs of the emergency with the food banks and the distributions, something we hadn't seen in the county, but there's really been a big focus on dignity, getting seniors food, getting our young people food, and I just want to thank you in particular for that, Heather, because I know you pushed for that in a big way. So thank you so much.
Thank you, Councilmember Rice. Just very briefly, I think the world of Heather and her team. And I've seen their work firsthand. It was extraordinary through the pandemic, but it was extraordinary before that. And that work and that system building gives me hope that we can address some of the complex food insecurity needs that we have in our community to a point where we can honestly say there's no reason we can't end childhood hunger here in Montgomery County. With the right push and the infrastructure that we already have, even more can be done. So we remain committed to supporting and thanking the Food Council for the last 10 years, but recognizing that there's much more work to do and many more years to come. Thank you.
Thank you, Councilmember Glass, for he's spoken like a true leader who knows he's about to take the helm as the county council, making sure we move expeditiously. So I want to turn it over to the fearless leader, but that's something that Councilmember Jawando certainly said, is that I want to make sure that you focus on the staff and the board that are behind Heather, because just as we all know, all great leaders have a great team. And the only reason why they've performed so well is because that leader empowers that team to do great things. And so with that, I turn it over to the great leader of the Food Council, Heather Bruskin.
A little bit shorter. Thank you so much, Councilmember Rice and the entire County Council, for this incredible honor today. I'm so excited to be here. The Food Council journey began actually in 2010 through a series of grassroots community conversations where farmers and environmental advocates, hunger champions, and concerned residents came together to recognize that the work that they were doing around food wasn't achieving the vision and the goals that they had set forward because they weren't working together, and they needed to break down those silos and work collaboratively if they truly wanted to shift our systems. Similar conversations were happening nationwide, but what was different about what was happening in Montgomery County was that our county government agreed that that collaborative, collective action was critical, and convening and advocacy was a tool that we needed to achieve that change, and so they invested in that work with our first community grant in 2012, 10 years ago, that officially launched the Food Council. So as Councilmember Jawando already shared, I joined a couple years later in 2014. I was the fourth part-time coordinator that was hired in the first 2 years. So there were definitely bumps along the road, but we progressively grew and evolved, and we added critical staff and partners along the way, ultimately becoming an independent nonprofit in 2018. The depth and the breadth of our work, unfortunately, was required to expand dramatically during COVID, where we now have over 2,000 business, nonprofit, government agency, community, and philanthropic partners engaged in our work, and a professional team of 12 incredible, talented people, many of whom are with me here today. We're now one of the largest of over 300 food councils nationwide, and we regularly provide guidance to establish new food councils across the country. So what's the recipe for our success? Pardon the food pun, but we have a government that values the leadership and insight of our community and invests in system building and collective impact in partnership with people and organizations. And that investment has led to incredible progress building sustainability, equity, and resilience in our food system through addressing economic opportunity, resident assistance needs, education, and protection of our natural resources in an interconnected way. So we've created policy change that fights food waste and has established a robust, diversified organic food waste composting infrastructure. We've launched a MoCo Made program that highlights over 80 farms and food and beverage businesses that are bringing jobs and creating greater food production right here in our county. We're building the capacity of a robust food assistance provider network of over 100 organizations in implementing a 5-year strategy that's a national model for fighting hunger in a government-led initiative. And we're amplifying the voice and expertise of our local residents to inform issues from the neighborhood to the federal level through our Food Security Community Advisory Board, our Advocacy Action Network, and extensive resident listening sessions and surveys. And most importantly, we've invested over $30 million in both private and public funds in the past 2 years alone in both critical and emergency food programs alongside innovative initiatives that are making us stronger for future crises. And now with the Office of Food System Resilience, we're making permanent some critical government community partnerships that evolved during the pandemic to make this work, that much work lies ahead, to take it to the next level. The impact extends beyond our county's borders. We've been a leader in establishing both a new statewide food council and a permanent board on food issues through the Regional Council of Governments. But the best part is that these are collective accomplishments. It's not just the Food Council's work or our county government's work. It's due not to one or a few people or organizations, but all of us together. Our combined efforts are leading us forward on a path to truly transform our local food system, and it's all made possible by a county government and a community working together, not only dreaming big, but also working hard, strategically and creatively, in partnership towards our shared vision for our county. And I want to thank each and every one of us who have all played a role in making that happen. So thank you very much for this opportunity today.
So now I hope you see why I said what I said. As you heard those words, we can change whatever we want to change. We just have to commit to it. So with that, I'm going to read the proclamation. Whereas in 2012, a large gathering of community stakeholders joined together to envision a bold new approach to establishing a sustainable food system in our county, which resulted in the official launch of the Montgomery County Food Council. And whereas the Food Council quickly and effectively brought together business, nonprofits, and government, along with residents and advocates, to identify initiatives around education, advocacy, and capacity building in the food and farming sectors. And with 2,000 local and regional partners prioritized collaboration, transformation, and cultivation to address food security for more than 100,000 residents at risk for hunger. And whereas when the COVID-19 pandemic exacerbated and revealed the true extent of food insecurity in Montgomery County, the Food Council was a quick resource and a leader, connecting food assistance providers and advancing strategies such as the Farm to Food Bank program, Food for Montgomery, and local gardening programs. And whereas the Food Council continues to impact local, state, and national policy, reflecting its core priorities of equity, community, and economic and environmental sustainability, and serves as a model for other jurisdictions across this nation as a comprehensive, systems-based, effective approach to food security. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby celebrates the 10th anniversary of the Montgomery County Food Council and the invaluable impact that the organization has made on our community while working to expand an equitable and resilient local food system for all residents, presented this 26th day of July in the year 2022. Congratulations, Food Council.
All right, good. Thank you all very much. Those were wonderful and moving presentations this morning. We have several more proclamations this afternoon at 1 o'clock. And before we begin our general business, I just want to acknowledge a few people that are in the audience today. And I want to acknowledge our summer fellows who are here, as well as our summer interns who are working with us this summer as well. We want to thank them for their leadership and for doing all that they do, and they are light years ahead of where I was when I was their age. But I just want to thank them for stepping forward, and I know many more are not here today, but helping us this entire summer. So thank you all very much for all that you do. We are now going to move on to our agenda. I'm sorry, Councilmember Katz.
Thank you, Mr. President. I just wanted to take a moment to introduce our summarized student, Eric Robinson, who is a 16-year-old rising junior at Rockville High School, and his interests are in law, politics, and music. So I think he could sit right up here with us right at any time. Thank you very much, Mr. President, and welcome to Eric.
Thank you so much, Councilmember Katz. All right, we move on to our general business. Madam Clerk, do we have any agenda changes or announcements?
Good morning, Council President, Council Vice President, Council members. We do have a few agenda and calendar changes to announce today. Our first is agenda number 6, item D, Bill 1422, Police Private Security Camera Incentive Program established. This item has been added. Next, item 7B, the introduction of zoning text amendment 2208 Commercial Residential Zones, MPDU. That public hearing is now scheduled for September 20th, 2022 at 1:30 p.m. Item 7C, zoning text amendment 2209, accessory structures use standards. That public hearing is now scheduled for September 20th, 2022 at 1:30 p.m. We have a change to our lead sponsor on item 7D, the zoning text amendment 2210, streets and roads. The lead sponsor is the council president at the request of the planning board. Similarly, for item 7E, subdivision regulation amendment SRA 2201, streets and roads, that lead sponsor is council president at the request of the planning board. We have postponed item 8D, action resolution to define and address anti-Semitism. We have added item 8Y, introduction amendment to the county government's FY 23 to 28 capital improvements program and supplemental appropriation 2313 to the FY 23 capital budget, Montgomery County Government, Department of Recreation, cost sharing, MCG number 720601, $5 million, and the source of funds is current revenue general. Finally, we have a correction to item number 9, public hearing, 1322 buildings, comprehensive building decarbonization. We were able to schedule the Fed committee work session for October 17th, 2022. And the council did not receive petitions this week. Thank you very much.
Thank you very much, Madam Clerk. The clerk has circulated the minutes of the May 26th meeting for approval. Are there any changes? Seeing none, those minutes are approved. Councilmember Rice wanted to make a quick announcement
Thank you
before we
very
move
much,
on
Mr.
to the next
President.
item.
Thank you. And I just wanted to acknowledge our great summarized student, Layla Kyle, who's joined us. She's actually become quite the social media star after she took a trip to our agricultural reserve and got to tour a number of our farms there because in addition to her business management and entrepreneurship interest, she also has an interest in conservation and national resources management. So really want to acknowledge her great work with us this past couple of weeks in our office, and I know that she's a senior at Clarksburg, and we're looking forward to the great things that this coyote is going to go off and do. So really thankful for her being a part of our office. So thank you.
Thank you. We now move on to the next item on the agenda, which is the council sitting as the Board of Health. want to once again thank Dr. Bridgers for his hard work. And we will be receiving updates regarding where we are with COVID as well as other health topics this morning. And Dr. Bridgers, I will turn it over to you.
So good morning, Council President Albornoz, Council Vice President Glass, and the entire council sitting as a Board of Health. It's a pleasure to present to you again yet another COVID-19 update. What I'd like to do is frame COVID in a sense of it's been 28 months. And so it's no longer a novel virus. It's here. We've had multiple variants and subvariants, and we continue to use our shots planning to respond to the upticks and or wavelets. And so, next slide. And so, as I indicated, we've had multiple variants, and now the BA5 and BA4 variant has taken control as the predominant variant in Region 3, which is where Maryland and more specifically Montgomery County is. BA4 has comprised of, as these data are as of July 19th, and we update our metrics and our website daily. BA4 is 15.4%, BA5 is 72.7%, which equals 88% of the total. Now, keep in mind there is a World Health Organization variant of concern. It is BA2.75, yet another variant. And with these Omicron variants, we see that it's highly transmissible, and it causes mild symptoms such as cough, fatigue, congestion, runny nose, and fever. But even mild cases of COVID are cases of COVID and should be addressed as we've done before, previously with layered preventative measures, ongoing rapid testing, and isolation at home for 5 days. Day 6, wear a mask up until day 10. Now we have a significant number of slides, and in the interest of time, I'm going to move very quickly through the slides so Ms. Kimberly Townsend, who is our Senior Administrator for our Communicable Disease and Epidemiology, can give the Council a very cogent and succinct update on monkeypox, which we have destigmatized to identify it as Mpx. So you will hear us repeatedly say Mpx. Next slide. And so we continue to surveil the data, not only nationally, but internationally, and we noticed that when there was an increase of cases in the UK and in Europe, 3 to 4 weeks later, we experienced it here, more predominantly in the Northeast and then in the Middle Eastern states. And we're going through that now. We're currently trending downward. Next slide. We're currently trending downward. However, there is no evidence that BA4 or BA5 is inherently more severe than other Omicron subvariants. Again, mild COVID is mild COVID. If you feel sick, contact your primary care physician, test appropriately, and isolate accordingly. Next slide. And so when we look at the levels, we're continuing to trend downward. With our community levels, our case rates are still high. And there's layered preventative measures that we implement according to the Centers for Disease Control and Prevention. Next slide. And so we know that when there are medium cases where we were, but we moved into a higher case category because we had increased hospitalization and hospital bed rates in which we monitor accordingly. We have ongoing conversations, weekly conversations with our hospital partners to make sure that there are no significant impact and stress on our healthcare systems in the county. Next slide. And so again, we move from medium, and then there's the individual protective measures and the community protective measures, such as wearing masks in congested or crowded places based on individual preference and community level preference. When you know that you're in a congregate space, a large store, or a crowded space, masking is always a preventative layer prevention. But let's not get away from washing our hands. Let's not get away from having being in well-ventilated spaces. All of these are layer preventative measures that we've practiced, and we've shown to be better practices over the past 28 months. Next slide. And so now we look at high community levels, and again, there's personal preventative strategies. Wear a well-fitting mask. Operative word, well-fitting mask. Community-wide prevention strategies to protect folks that are at high risk. We are in constant communication with our correctional facilities, our homeless shelters, our assisted living facilities, our congregate living spaces, because we want to protect those individuals who are at high risk or who are more vulnerable. And so again, we have, next slide, please. So hospitalizations are high. Many of those 131 cases that you see have been according to acute cases in individuals who may be admitted for other illnesses but test positive and need additional treatment, whether or not it's monoclonal antibody treatments, infusion, Paxlovid, etc., and then they are released. We've seen this increase over the 5 or 6 previous waves that we've seen, and even wavelets, which are smaller upticks, and then we have decreases. Next slide. And so again, looking at the deaths, our death in Montgomery County, our deaths are lower than the state, which is an indication that we are a well-populated county, but we still need to do more to get boosted. So we have ongoing vaccination clinics, we have ongoing testing clinics. We continue to work with our great community partners to put these effective programs in place. Next slide. Next slide. Speaking of which, we've had multiple conversations about where will we be in the fall versus where we were last fall. And one of the challenges that we had last fall was we didn't have pediatric vaccinations. We know that we have a significant number of our 5 to 11-year-olds who've been vaccinated and who are now getting boosted. We lead the state in the number of pediatric vaccines that are administered. That's, again, contributed to not only our team, our public health team, HHS team, but our great community partners. And we continue to do that in an attempt to keep our students in school. We know that policies are set and guided on the level of vaccination rates, those individuals who are protected or have some protection, and we have encouraged our community partners, our Montgomery County Public School partners, continue to support us with our vaccination strategy, and they have been tremendous in doing that. Next slide. But we want to encourage you to come out and get tested. We want you to continue to get tested. We see that our tests at our static sites in the county have somewhat dropped off. If you're traveling abroad or to those spaces where you know that there may be higher community levels or higher community level transmission, please get tested at one of our sites or your primary care provider or an urgent care or somewhere in the county, CVS, so that you can know your little COVID status, isolate, and suppress and mitigate further transmission in the community, which is what we've done over these last 28 months. I continue to say that, but it's a great effort. It's a great effort on our community partners, on our county leadership. Next slide. And so these are the young pediatric vaccination clinics that we have ongoing. We ask that all our great countyans take note as they prepare to return back to school in the fall. School is just around the corner, and we need to continue to implement those best practices now in order to prepare for the services and the training, education in the fall. Next slide, please. And so lastly, with our Novavax vaccine, it is a community firm. It has received emergency use authorization, have been approved by the FDA and the CDC. 3 takeaways. It's a traditional based vaccine, which differs from the mRNA Pfizer and Moderna and the vector vaccine, which is a Johnson & Johnson. It is protein-based. It's been around for over 30 years to treat other conditions such as shingles, hepatitis B, Tdap, just to name a few. And we hope that those individuals who are unvaccinated or who have some hesitancy take note of this. We haven't received it in the county yet, but we are preparing to have doses available upon request at our our fixed sites, I should say. The vaccine hasn't been approved for a booster, so you have to get your primary series, your first shot and your second shot. And then lastly, we're waiting for it to get in the county. Last point I want to share, I've been talking about in our Board of Health briefings, yet another tool, a resource as part of our surveillance, our shots planning. Next slide. Our wastewater surveillance. I am pleased to say that we have our kickoff meeting next week with the University of Maryland to begin wastewater surveillance to identify those sites in those high-risk categories or in spaces where we know we see more incidents traditionally by either case rate, by census, by race, ethnicity, by age, and we will use this as yet another tool and resource to suppress and mitigate any false surges. It's a 6-month pilot. We hope that we can use it as a demonstration project to not only share at the federal but also at the state level and use as another model program, which many of our programs have been modeled after. I'll stop there. I know there was a lot. I welcome any questions from council, but I want to spend more time talking about our Mpx surveillance and work that we've done, that we began even before the World Health Organization declared it as a public health emergency back in May, on the 24th, I believe. So I'll turn it over to Ms. Townsend.
Good morning. Next slide, please. Here you'll see a map regarding current U.S. cases of Mpx. This is as of July 22nd. Since then, there has been an increase in cases. There have been increases about 919 cases in the U.S. since last week, and 25 cases in the state of Maryland. On July 23rd, the World Health Organization declared monkeypox as a public health emergency. Just want to note that, as Dr. Bridgers mentioned, back in May, when we started to see cases increase in the United States, we started working on a plan by sending out a public health advisory and looking at resources that we could use to address the issue. And also to note that there were, as of July 22nd, there were 71 cases of Mpx noted in the state of Maryland. Next slide, please. In terms of an overview, I'd like to mention that anyone, regardless of gender identity or sexual orientation, can catch Mpx. However, a number of the cases in the current outbreak are among specific populations. People who do not have monkeypox symptoms can't spread the virus to others, and symptoms generally last from 2 to 4 weeks. There is post-exposure vaccination recommended, and we hope to quickly identify these cases so that it can be provided. We want to remember that although transmission is most likely to occur as a result of direct contact with lesions, even crusted or scabbed lesions, transmission can occur through respiratory droplets and fomites, such as linen or towels and things that are shared. Even though it is not considered a sexually transmitted infection, Mpx can spread during intimate physical contact between people. Again, anyone can get Mpx if they have close contact with someone who has the virus. Next slide, please. In terms of vaccinations, Montgomery County Public Health Services has received a very limited number of Mpx vaccine doses. Availability is expected to expand in the coming weeks and months. We're working with the Maryland Department of Health to ensure that vaccine is available to high-risk exposures, namely those that are known contacts identified by public health via case investigation, contact tracing, and risk exposure assessment. Presumed contacts who may meet the following criteria may also receive the vaccine at this time, and those are that have known sexual partners within the last 14 days that are diagnosed with Mpx. Also, those who have had multiple sexual partners in the past 14 days in areas with known Mpx. Next slide, please. So currently, we're working with primary care providers to identify cases and coordinate testing and referral. Close contacts may be eligible to receive post-exposure prophylaxis medication, and this is on a case-by-case basis. We're regularly consulting with the Maryland Department of Health regarding treatment and post-exposure prophylaxis. We also continue to monitor individuals that are in isolation at home and help them understand when it is time to end that isolation. Additionally, we are providing treatment to contacts of those that were exposed in other jurisdictions but currently reside in ours. Next slide, please. For community outreach, we've developed an online survey. It's very similar to the survey we used for COVID-19. It's for residents interested in receiving a vaccination to protect against Mpx. The survey is initially focused on the highest risk populations, as I mentioned earlier, and we expect that we'll begin to use this sometime within the next week or so. As vaccine becomes more widely available, eligible groups included in the survey will be expanded and we can offer appointments. We're also working on risk update communications and screening through the Dennis Avenue Health Center sexual health programs. Healthcare provider communications, our HHS Mpx webpage, which will include fact sheets, frequently asked questions, and other social media outreach. That's just a brief overview of what we're doing to address Mpx, and I'm open to answering any questions that you may have.
Thank you both very much. We do have colleagues who are in the queue. I have Council Vice President Glass, followed by Councilmember Navarro, and then Councilmember Rice. Council Vice President Glass.
Thank you, Mr. President. Thank you for the presentation. I know that we've been corresponding, my office and myself, with you over the last number of weeks waiting for today's briefing because my inbox, my cell phone, my DMs have been flooded with residents who are very concerned about monkeypox. Mm-hmm. And we see what is happening in other jurisdictions, and they are concerned that we are not adequately equipped to provide vaccines to make sure that everybody is healthy and safe. Can you give an update as to the state's role in this and just remind people that we are not like Washington, D.C. We are not a city-state with direct access and direct control, and that we do rely on the state and Governor Hogan to provide us. So can you share what that relationship is right now?
Mm-hmm. So thank you, Council Vice President Glass, for that question. So the state, unlike the District of Columbia, we don't receive our vaccines directly. We have been working with the state. The state manages the contact, investigation, case tracing, et cetera, and provides us with the information. But more importantly, once the vaccine is received from the CDC's Strategic National Stockpile, it's distributed and allocated throughout the state. The three largest counties, Baltimore City, Prince George's, and Montgomery County, received the first tranche of the vaccines. We requested more. We did an analysis with our HIV STI clinic to identify those individuals who were at greatest risk. We notified the state, we presented it to them. We've been supporting the state's contact tracing effort. We also know that some of the cases, as far as our post-exposure prophylaxis that we have administered, have been interjurisdictional. They've come from other places. And so we prepare for that. We've met with our clinicians, our doctors. We've participated in calls with the CDC and the state so that our team could be well informed. And so going back to your original question, we don't get the doses directly. The doses that we have is based on demand, and we have set up a system, a strategy in place where that we can identify those individuals who are at greatest risk, provide pre-exposure prophylaxis, and then post-exposure prophylaxis. So we've built the system, but again, we don't control the doses. We've requested more doses, we've requested capability to store more doses, and we've also talked about expanding to our Germantown Health Center because we know that we are building an HIV STI clinic there, and we want to have the greatest access for everyone. And Kimberly, you can add to that.
The only thing I would add is just reinforce that we have requested more doses. The doses that we have received, we are providing vaccination and we're providing screening to our community members. And we hope that we'll be in receipt of additional vaccine over the next week or so.
It appears to me this is deja vu all over again, which is another reminder to all of us in government at all levels that we need to be prepared for health emergencies, future pandemics, try to stem them so that situations don't become pandemic-like, despite the WHO declaring monkeypox a global health emergency. And I appreciate the framing today about who this affects, and it affects all of us. And some of that framing has not been accurate over the last week or 2 weeks. Not only, I'll say, here in the county in some public conversations, but across the country, we need to make sure that these vaccines get to everybody because it affects everybody, not just one segment of our community. Dr. Bridges, I don't know if you were...
Yes, Council Vice President Glass. One point that I omitted and it jogged my memory when you referenced deja vu. So anticipating of the increase and providing those community level protective measures, we increased our staffing as well. We knew that we needed more clinical staff. We requested from the department to get not only a nurse practitioner, but another nurse. We know we need to treat folks, we need to isolate folks, and we need to make the county safe. So I just wanted to add that.
Absolutely. Well, come to us and let us know what we need to do to help with staffing and help with whatever other preventative measures and administrative procedures as well. One last thing I will say, there have been some residents who have expressed concern over what they consider a catch-22 in our policy, being that an individual can only receive a vaccine if they put themselves at greater risk. And that does not seem to be the best health policy. Can you explain that a little bit more?
We've had some calls on our helpline regarding individuals who wanted, and I know as of this morning, the District of Columbia moved to a single-dose treatment regimen. We're still monitoring our community-level transmission rates and are still guided by a 2-dose treatment. We've had calls, principally to share with us candid conversations about folks putting themselves at risk. Absolutely not. We will treat you, we will assess you, we will contact our clinicians and provide the best information. There is no need to put oneself in harm's way to get vaccinated. We are assessing it. We've identified folks. Our case managers, our clinicians have worked with our community partners. We've done extensive outreach over the past 6 weeks to identify those individuals who are at greater risk. And that's our primary focus. We want to safeguard those individuals who are at greater risk and then expand it in a public health ring practice, if you will, similar to what we did with COVID, as you referenced before. We started with those individuals who were at greatest risk, our seniors. And then we looked at those individuals who had chronic illnesses. And then we looked at those individuals who were unvaccinated. We've taken a similar public health strategy to identify those individuals who are at greatest risk. Please, if you have any questions or concern, please, for all our countyans, our great countyans, please contact our helpline. We have individuals there who've been informed and prepped. It's a bilingual helpline. And if you have some concerns, please send us a note because we are addressing all concerns. I hope that answers your question, Kimberly, if you'd like to add anything to that.
Last question I have, in correspondence with the state, do we know when we will expect more doses?
So we were advised the next few weeks we should receive more doses, the 3 jurisdictions that currently have doses. We don't know for sure. We don't have an exact date, and so we're still waiting.
So I've requested an additional 600 doses in addition to the tranche that we have based on the capacity. The state has received that request, and Kimberly and her team are waiting for a response.
And so it request of 600 doses in addition to the 200 we've already received?
Yes, that's correct.
Okay. For a jurisdiction of 1.1 million, let's get the state to act as quickly as possible. People want this. We want to stem the spread of this problem, and it is, we're going to do everything. And so keep talking with us to let us know what we need to do aside from continuing to contact the state and letting our residents know that we're doing everything that we can within the powers that we have here. So thank you for the update.
Thank you, Council Vice President Glass. I've got Councilmember Navarro, followed by Councilmember Rice.
Thank you. Thank you again for the presentation on both issues. I want to associate myself with Vice President Glass's comments. Many of the questions were the same questions I had because it definitely feels like deja vu. And so, I also was trying to figure out, I try to put always myself in the shoes of our residents, various communities, et cetera. And I personally trying to find information about this, it is quite daunting because it is confusing. And we are saying, when you Google Montgomery County information on Mpx, we are telling residents that if they believe they've been exposed, to contact their health provider or a community provider, such as an urgent, care center, and also those without a healthcare provider can also call the disease control program. So we do have that. When we say in our website how it's spread, it is definitely there that it can be through respiratory secretions, touching items. Pregnant people can, spread the virus to the fetus, etc. And I worry about the message as Council Vice President Glass was mentioning, because even though up until now there has been all this reporting on how, which are the populations that is being spread. We know that in Washington, D.C. there was a pediatric case. We know there's one in California. So it is clear that this is definitely starting to spread in a lot of different ways, and perhaps it is not very clear, whether it's true that it's primarily sexually transmitted, obviously, right? I appreciate your responses, and unfortunately, I feel like we're back into that same conundrum of waiting for the state to respond to the needs of Montgomery County, the largest jurisdiction, all over again. However, I think that we learned so much during the pandemic that perhaps it's time to activate a lot of those activities so that we can be proactive. So we had so many communication strategies that were extraordinarily successful. I think we need to activate that, right? So in all of our communities, with the Latino Health Initiative, with the African American Health Program, Abuelina should be talking about monkeypox at this point. I think that we need to figure out how to then pivot that kind of communication so it can be a little clearer, because as I said right now, even if I start Googling and looking, it's very confusing. The testing issue is a very interesting one too, because it seems like it's all over the place, right? Is there a possibility for the administration to start looking at, like, could we stand up within our, Dennis Avenue Center or something like that, testing protocol? Because I don't even know if the primary physicians or urgent care, if there's like a very specific criteria to do the testing. Is that a possibility for us? And I know it takes resources, which, we obviously have to look into, but is there a way for us to at least start doing that?
So yes, there is. It's a great question. Previously, the only avenue we had for testing was the Maryland State Lab. And we had to have approval before we could send specimens to that lab. Mm-hmm. Recently, the good news is private labs are now able to run the tests, which means community providers can collect their own specimens and send them directly for testing. So we're moving in that direction. At Dennis Avenue, we have done some testing using the state laboratory, and we're hoping to continue to coordinate with our community providers so that they know how to use that service as well. So we are going in that direction. Resources are still a little limited and things are unfolding.
Right.
So Councilmember Navarro, let me just back up a little bit. We aren't going to wait for the state. We started our planning, and again, many of the other jurisdictions who have access to vaccines now are replicating our plan. We've also had conversations with our community partners Montgomery Cares partners, and I agree we need to have more conversations with our health initiatives to get them prepared. Absent of having any vaccines available, we can still be prepared once those vaccines become available. And so we did learn some hard lessons from COVID, and so we've used those lessons to help shape and craft our plan, our Mpx plan now, as well as our future planning in the fall for any other surges or wavelets. So thank you for those remarks, and I have made notes, and we will have follow-up conversations. But we don't want to wait. We can't wait, and we've seen how the virus has increased. And, you know, I've responded to viruses going back to H1N1, Ebola, Zika, and it's all a repeated pattern if we delay. And so we can't delay. And so our clinical teams have been instructed. And in all likelihood, we will have mini sites, micro sites, pop-up sites, et cetera. And we're building that plan now. So I just wanted to share that bit of information with you this morning.
Thank you. I appreciate that. Again, huge believer in being as proactive as possible, because we do know that in a such diverse county as ours, we learned that lesson over and over again during the pandemic. Not everybody gets the information right away. So even having the information is so important because it puts you at ease, right? You know, explaining to people that, you know, my gosh, it's not like it's a deadly disease, but here's what you need to look out for. This is where you might be able to go. This is where you can get tested. This is how you can protect yourself and things like that. I think that goes a long way because we want to minimize the fear also. You know, the anxiety and the fear out there is huge, and that is done through information. So, so thank you again. I know all of you are the experts. You were the ones executing a lot of the things that we had to put forth during the pandemic. So I appreciate that, and I just think that we've reached that point to start, obviously, elevating a lot of that. Thank you.
Thank you. Councilmember Rice.
Yes, I have to associate myself with what a lot of my colleagues have said. I find myself feeling as if we're right at the precipice of where we were when former President Trump was saying that the United States had nothing to worry about. Fortunately, we're under new leadership now where folks do understand. I've heard that the Biden-Harris administration is right on the cusp of declaring this a public health emergency. I know the World Health Organization has already declared it an international concern type of public health order. So from that perspective, Dr. Bridgers, knowing that us being out in front of this, and I appreciate you saying that we're not waiting for the state, but I do think that it's important for us as the 24 jurisdictions in the state of Maryland to make sure that we're uniting together to get that message out there, to put pressure on the Hogan administration to ensure that we get out ahead of this, unlike we did with COVID. So can you share a little bit about what some of the conversations between your colleagues have been across the state, seeing that D.C. Has done what it's done, and because we are a Washington metropolitan area who oftentimes work together when it comes to this collaboration like we did with COVID. So can you share a little bit about what some of those conversations with you and other health leaders across the DMV has been?
Thank you, Councilmember Rice, for that. Some of the conversations, let me just pause for a minute. Demand is always a challenge. When there's a new virus, a new community level concern, it's always those individuals who are at greatest risk, who have limited access, or who are underserved, who don't get vaccinated. And so those are some of the discussions we're having. Yes, those larger populated counties in the state have received vaccine, but what about those counties that are in the outliers or in the southern regions? We know people travel. We know people have relationships outside of their current space. And so those are some of the conversations. We need greater access, with the World Health Organization expressing concern as it being a public health challenge. I won't say issue, it's a challenge. And with the Biden-Harris administration recognizing that challenge, available funding should be afforded to all of the states and their jurisdictions so that we can implement best practices, so that we can provide equitable and accessible vaccines and services, so that we can build best practices. Those are the conversations that we are having, because I am a firm public health believer that what happens in one community often happens in other communities. And we need to think about that, and we need to think about those individuals. So during the Maryland Association of Counties upcoming meeting next month, we're going to have these conversations. We're going to push for more awareness. We're going to push for more support in a very calculated manner, of course, but in a manner that's going to be effective. So, Councilmember Rice, when you asked me about those conversations, those are some of the conversations. And we need to have more conversations. We changed the cadence and the frequency, but we need to talk weekly. And sometimes we've been on calls more than once, either at the state or federal level. We need to be empowered with all of the research and the data and the information that we've prided ourselves on regarding COVID, similar to Mpx.
Well, thank you very much for that, Dr. Bridgers. Mr. President, you've been incredibly gracious. I know as chair of the Health and Human Services Committee, this is something that you've been equally concerned about. I would like to ask that we possibly pen a letter from the council to the governor, similar to what we did before with COVID, certainly requesting that we prioritize this to be able to get out in front of this, and also working with our federal government partners. I know that Luke McGowan from the Office of Intergovernmental Affairs at the White House is very anxious to work with local jurisdictions, and so I think that CCing him on that as well, so that the White House is aware and can ensure that they are working with our state administration to ensure that we have the right support to make sure that we're protecting our community is incredibly important. I did just want to close this one last thing on this point with Mpx, and then I do want to ask a question about COVID by just seconding what Council Vice President Glass said. This is something that may have started in terms of being projected in certain communities, but the reality is just like we saw with COVID. I remember when my own family said that COVID didn't affect black people, and black people didn't get COVID. And those are the myths and stereotypes that were out there back then, and quite frankly, the things that caused many people in our community to die. And so from that standpoint, we need to ensure that everyone has the information that things like this are things that everyone should be aware of, regardless of what community you're in. It does not matter. This is something that we see is now affecting everyone and is transmissible. I did want to ask a question about COVID, because now as we're starting to learn a little bit more about it, there's a lot of questions around long COVID and those effects. And I'm just curious as to, as we saw in our communities of color and a lot of our communities of lower socioeconomic status, to where they had pre-existing health conditions, they were more susceptible to more cases that were more severe. And so I'm curious as to whether or not we've linked some of those to also severe cases being more that are susceptible to long COVID symptoms. And then from that aspect, how that then is affecting them when it comes to their employment, their lives, all those other kinds of things as they try and continue to live. They're alive, and that's great, but if they have these underlying conditions that are continuing with them from months, if not years, as we've heard from some of the first cases, are we tracking some of that, and what's some of the data that we're getting from that?
So thank you, Councilmember Rice, for that. I don't have the data before me, but we've been doing extensive studies with our EPI partners and our hospitals to look at occupational health, our Office of Health in the county, to look at those challenges. We know that long COVID affects the body's response and could exacerbate into chronic illnesses. And so we have data. We've been presenting more data. And that's a great question. I think we should have a town hall on the impact of long COVID so that folks understand. Because one thing that goes along with those things, not only long COVID, but the reinfection rates. We know that in those individuals who are currently hospitalized, who are getting reinfected now, are between 18 and 64. Those individuals who are going out, they're traveling, and the impact on those. And we know with these subvariants, the transmissibility is high. They built a mechanism a genomic mechanism to evade the immune response system. We have vaccines. And so when you look at the variants, we are being strategically forward in looking at how we know that there's high transmissibility. What's the messaging? What's the health education? What are we sharing with our community partners, our physicians? What are our physicians seeing? What's the impact on their caseload and their case rate? And then more importantly, how is it impacting, as Councilmember Navarro said, our diverse community? And so we need to continue to have those conversations. Again, that's part of our planning. That's part of our surveillance, the shots, the essence shots. And so we're doing that. I have more concrete data. I just don't have it before me, so I can't go any deeper than that. I can send it to you, though.
No, that would be appreciated, and I really love your idea about making sure that we highlight those effects, because we know that just as we saw the more severe cases of COVID in our communities of color, which is representing a large portion of our population, we also know that that then ties to a lot of those long COVID cases. I know that there are a number of family members that reached out to me when we had our celebration of life for those who had unfortunately lost their life to COVID, and many of those folks who had battled and been right at the cusp of death and now have severe long COVID symptoms have been asking for more attention to be brought. And I think that it's important for us at this time to do that, especially partnering with our BIPOC health initiatives to make sure that we can get that outreach. You know, we've built up these great systems with Por Nuestra Salud y Bienestar, with the African American Health Program, with the Asian American Health Initiative, and we can bring them all together to help us to bring this to the community forefront so that we can really start addressing some of these issues. One last question. I'm sorry, Ms. President. This is really important. I'm just coming off a national conference, so I have all this stuff in my head. When it comes to what we're talking about with COVID immunity, I'm curious as to whether or not, because I know that that's really being studied now for those people who have never had COVID before, and really starting to try and understand if there is some potential genetic or whatever the case may be. Have you heard of any studies, and have you heard of, you know, we have NIH right in our backyard. Have we heard of any studies that are along those lines? Are they requesting people's partnerships? Because if they are, if anybody who hasn't had COVID to this point, or at least thinks that they haven't had, you know, there may be a person who's had it but doesn't realize they did. Are there those kinds of calls to action for individuals who can volunteer to be a part of studies like this to help us to try and identify if there are certain immunities that some people may have, and how we can then utilize that to synthesize something to be even more effective in terms of not just some sort of a vaccine, but actually some sort of a cure. So
Sure. Thank you, Councilmember Rice. And I just pulled out an article that I printed out last night that talks about genomics and RNA vaccine and development of those instruments that you just so once I read it, I can send you annotated bibliography and summary of those findings. But yes, we are looking at that. We're also having a discussion with those individuals who contracted COVID and those individuals who have been reinfected, and looking at those rates. And so we're working with our community providers to get more data. Again, our EPI team is looking at all of the lenses through the proverbial prism, just to see about those nuances, just to see where we are. Because again, it's no longer big COVID, uppercase COVID, is lowercase COVID, and we need to think about the impact, but generational impacts. But what, how are our children who, on their learning, does it impact their learning ability or their capabilities, or not being in school? How does that impact future direction and their capacity to not only learn, but to grow mentally and physically? And so we need to look a lot across the lifespan at those nuances and how they will impact our community.
Thank you very much for that informative and important presentation. So there are a few follow-up items that we will make sure that we address as soon as we get back from the break. I very much agree with the letter that Councilmember Rice noted, so we can work on that right away. And we will be having a committee session within HHS as soon as we come back to see where we are with monkeypox and what more needs to be done and what more we can do as a community. But thank you all very much.
Thank you, Council President Albanos, and thank the Council for their support in all the efforts that we do.
Absolutely.
Thank you.
All right, we move on to the next item on the agenda, which is an action. This is an action regarding Executive Regulation 1521, Racial Equity and Social Justice Action Plan. The Government Operations and Fiscal Policy Committee recommends for approval. I'll turn it over to the chair of our GO committee to make some opening comments if she'd like to.
Thank you, Mr. President. So this is the long-awaited regulation, Executive Regulation 15-21, which lays out the Racial Equity and Social Justice Action Plan for the executive branch in order to implement the Racial Equity and Social Justice Law. I want to extend a huge thank you to both our council staff as well as the staff and the administration who's worked so hard to get us to this point in order for us to have this regulation in front of us. It is obviously very important and also critical to recognize that this work has been very deliberate and very patient up until now, because we're really just putting forth and setting up the foundation to implement this important law, which it is so expansive that we should all also practice a lot of patience and understand that it's going to go through different iterations. But the reality is that, in my humble opinion, we have made extraordinary progress. And to me, one of the most important things to recognize is that anytime we are trying to address something that is so structural in nature, that has been institutionalized for decades and decades and decades, that it's going to take time. But when you start noticing that almost every sector that we have interacted with has been pretty much on the same page in terms of wanting to take into consideration racial equity and social justice in their work. And that to me is a very important first step, because if we are not engaged in this kind of awareness, then it's just sort of like a one-off, and it's just sort of piecemeal, and it's just kind of like up to whoever thinks that this is an important issue. When in reality, I think that we can say that, at least from my perspective, since we passed this law, the work that we have encountered here in Montgomery County has been pretty much seen through that prism, and it has been embraced by everybody in that respect. Now, of course, to me, this is the first step, because now it's just that hard work of implementation and of figuring out how do we ensure that the data is available and that everything is implemented with fidelity. And so this regulation basically really begins to enshrine how that will begin. So I want to, again, thank Ms. Tiffany Ward for her extraordinary leadership, taking something that has never been done before and giving it shape. And of course, Ms. Singleton, who is here on the County Council, helping us as an institution also address this issue. So what I can say is that the Government Operations and Fiscal Policy Committee did approve the plan. And as I said earlier, this is for the executive to be in compliance with the law. I want to remind everybody that if the council does not approve, disapprove, or extend the time for consideration within 60 days within 60 calendar days, the regulation automatically takes effect, because it's method 2. And we did receive some testimony from CASA, letters supporting it, and we did have some conversations about capacity and resources, and this is something that the council is going to have to continually assess. Even though I think that we are kind of a model in the region, because I've been present in some presentations from other jurisdictions in the region, and we are the only ones that have actually invested the amount of funds that we have so far. That is really important, because it's not enough to just pass a resolution, a policy, or a law, and then if you don't have the resources to implement it, then you're back to square one. So I think that's going to be important to continually assess the capacity. So with that, what I'd like to do is let Ms. Ward, if you have any comments. Okay, and then Ms. Singleton, let me turn it over to you then to just walk us through some of the specifics of the regulation. As I said, the Government Operations and Fiscal Policy Committee was satisfied with it, and wants everything to just move forward. But I don't know if the microphones are deciding not to act up this time. There you go. Looks like it's that particular table, so yeah.
Good morning, Chair Navarro and council members. This executive regulation, so the purpose of it, as Chair Navarro articulated, is to articulate the details about the work of the Racial Equity and Social Justice Act, and to look at the departments and determine how they might work with their action plans. There is a very strong focus on community engagement, which we're pleased about. Also workshops and training, which we talked a bit about during the GO committee. Consideration in establishing new programs and evaluating existing programs, developing racial equity and social justice in the budget, and Tiffany and Ms. Ward and her group has developed a budget equity tool that we've started working with. And then the metrics for measuring progress in short and long-term goals, and guidelines for each department and office to develop action plans. In addition, in our office, we are encouraging all staff to take the training that is being offered by the Office of Racial Equity and Social Justice, and hope that they continue to do that.
Okay, so that's what it contains, and as I said, our Government Operations and Fiscal Policy Committee approved, so I want to thank Councilmember Katz and Feetson for all their work as well through this whole entire process, and it's now in front of the council.
Thank you so much, Councilmember Navarro. Councilmember Jawando.
Thank you. Just wanted to thank Ms. Ward and Ms. Singleton and the executive branch for getting this over, and for the work of the GO committee, and particularly Councilmember Navarro for your leadership on this issue nationally and locally. As I've said many times, that was the most exciting part of starting on this new council almost 4 years ago, was working on this and getting this done. And this is just the latest example of commitment by you and by all of us to actually making this mean something. The community engagement that we always talk about, putting the systems in place, the funding, getting your office, Ms. Ward, what you need. Not just having you be a tag along, but deepening the work in the capacity within every agency and hopefully contractors as well, to do this in a meaningful way, to deliver the data collection and analysis and systems change, which are mentioned here. I just want to point the three things there: community engagement that's deep and meaningful, and that happens every time, not sometimes; collection of data and analysis, and to lead to systems change in our policy. I just had a great conversation yesterday with our summer fellows about how do we make this really meaningful. And I think this regulation, while not necessarily the most exciting on its face, is really the work. So thank you, kudos to Councilmember Navarro and to all of us, and look forward to making sure this gets implemented with fidelity. Thank you, Mr. President.
Thank you. Well said, and truly thank you, Councilmember Navarro. The leadership has been extraordinary. I want to thank Ms. Singleton and Ms. Ward for your leadership as well, and we do look forward to the action in the action plan. So thank you. We're missing Council Vice President Glass, but we have other things to move on to in the agenda, so let's go ahead and move on with the vote. We have a committee recommendation, so all those in favor of the committee recommendation, please raise your hands. And that is unanimous among all those present and virtual. Thank you all very much. We now move to the next item on the agenda, which is item number 4. These are presentations from our Montgomery County Council Summer Fellows. I had the opportunity to meet with the Summer Fellows recently, as many of my colleagues have as well, and was once again deeply impressed with their leadership, their thoughtful approach to this critically important work. And I just want to begin in the same place I began when I spoke with them just a few days ago, and that is thanking them for their interest in public service, not just the presentations that they will be presenting today. These are extraordinarily complex times, And we need now more than ever innovation and the ability to be able to think holistically about some of the most challenging issues that we are facing today. So thank you all so much, and we look forward to hearing your presentations. And that was intended to buy us a little bit of time as well so that we can work on the microphones, which I'm hoping are now operational. But with that, I will turn it over to Ms. Rodriguez Hernandez. And I want to thank her for taking on this very important task of helping to shepherd these remarkably talented summer fellows. So thank you for your leadership.
Thank you, Council President Albanaz. Well, good morning, council members. Ms. Dunn and I are excited to be here with you all today in our 6th consecutive Summer Fellows cohort, filled with 8 stellar fellows this year, so we're very excited. As you know, the Montgomery County Council Summer Fellows Program was started in 2017 with the goal of providing current graduate students in public policy and planning and related fields the opportunity for real-world local government experience and the ability to meet directly with senior leadership throughout county government and elected officials. This year, we have, of course, a few fellows placed in the County Council, as well as throughout the executive branch, including the Community Use for Public Facilities, Technological and Enterprise Business Solutions, the Mid-Regional Services Center, and the Montgomery County Department of Transportation. In addition, as part of their program, the Summer Fellows are tasked with conducting an independent research paper and presentation focused on a topic that is relevant to Montgomery County and, of course, the Council. And so that is why we're here with you all today. The topics of the presentations range from the environment, transit, evictions, early care and education, language access, and the arts. So without further ado, I'm going to turn it over to our fellows, who will go through all 8 of their presentations and then turn it to you, Council President, for any questions from the Council. Thank you.
Why don't we do this, just have 2 presentations and then questions, and then kind of go through sequentially. That way nobody gets shortchanged and we can make sure we hear from everyone.
Good morning. My name is Will Brooks. I am an MPA student at the University of Georgia, and my research this summer has been on the arts and entertainment districts. Are they ineffective, impactful, or indecipherable? So they were started in 2001 by the state of Maryland. The arts and entertainment districts were designed to spur economic development and boost tourism through cultivation of the arts through economic incentives. There's 3 main core tax incentives: the property tax credit, the artist income tax modification, and the admissions and amusement tax exemption. And the property tax credit is administered by the county. There's 3 A&E districts in Montgomery County: Silver Spring, Bethesda, and Wheaton. Silver Spring and Wheaton are managed by regional service centers, and Bethesda is managed by a nonprofit, the Bethesda Urban Partnership. The Maryland State Arts Council reported that the economic footprint of these districts in fiscal year 2020 was approximately 1,400 jobs, over $148 million in state GDP, and $46.9 million in employee compensation. However, while the state reports broad economic impact, the incentives are being underutilized. In 20 years, only 9 businesses in Montgomery County have used the property tax credit. Only 12 artists in Montgomery County have used the income tax deduction in 2021, which represents only 1% of estimated artists in the Montgomery County A&E districts. And only 1/3 of A&E districts have businesses that use the admissions and amusement tax exemption in 2020. If you take a closer look at the Silver Spring A&E district, using other indicators of health, the data shows conflicting impact. So while events tripled, the number of galleries, venues, museums, arts organizations, and public art only increased by 1.6% from 2012 to 2020. There's also no data collected showing the growth of artists living in the districts. They're also unable to identify the total county expenditures to these districts, and the tax incentive information from the State Comptroller's Office does not show district-level data. Every year, these districts are required to report an annual report to the Maryland State Arts Council. However, looking at the evaluation, there's only 1 out of 8 elements of the program goals are being evaluated by the Maryland State Arts Council, and only 9 out of 41 reporting elements are used for evaluation. And looking at the county and district level, there is no formal evaluation process. Looking at the annual reporting process, Even though the Montgomery County Council has responsibility for designation and redesignation of programs and funding, there's currently not oversight for these programs. So with consistent evaluation and accountability, the county can better utilize these districts. In addition, evaluations of these districts should prioritize how the policy impacts artists and organizations, not just economic development. My first recommendation is in the 2023 Future Priorities Letter to the General Assembly, the County Council should request the MSAC to develop metrics for evaluation. The legislation assigns responsibility to the state through administration and reporting requirements, and currently the MSAC is only evaluating one program element. My second recommendation is to task the Arts and Humanities Council of Montgomery County with designing an evaluation method. This would allow Montgomery County to include the program goals from the state, but to also incorporate missing racial equity and social justice goals into the evaluation. My third recommendation is to designate the Arts and Humanities Council of Montgomery County as the administrators of the Montgomery County A&E districts. This would address the lack of oversight for the program and creates accountability. The Arts and Humanities Council already advises artists, nonprofits, and businesses on A&E district issues in an unofficial capacity. And this would also require an oversight meeting with the AHCMC. And my fourth recommendation is to improve data collection. So this would require any funding for the A&E districts to be line item budget items and to require districts to keep careful yearly records of all annual reports. Ineffective, impactful, or indecipherable, currently the A&E districts are the latter. However, Montgomery County Council can determine their effectiveness and create a better arts and cultural landscape for all residents. Thank you.
Thank you. And so once again, we'll go to Ms. Brotman next, and then we'll pause and ask questions of the first two presentations.
Good morning, council members. My name is Sarah Brotman, and I'm a second-year MPP student at Duke University. Today, I'm going to be talking about means-tested transit and what that would look like in Montgomery County. Means-tested programs are defined as programs that limit eligibility to individuals and families whose incomes fall below a predetermined threshold. So why are we talking about means-tested transit in relation to means-tested programs in relation to transit? Even in Montgomery County, one of the wealthiest counties in America, 7% of residents lack access to cars. These individuals are more likely to be people of color, low income, and non-English speaking. Ride-on customers largely mirror this demographic. The Office of Legislative Oversight recently released a report that shows that people who lack reliable access to transit are also less likely to seek healthcare on a consistent basis. And this is just one of the negative externalities of lack of access to affordable transit. As DC pilots means-tested fares and Alexandria continues their free bus initiative, it's clear that our neighbors are already moving towards equitable transit. As a regional leader in innovative policies such as guaranteed basic income, Montgomery County once again has the opportunity to be a leader in equitable policy. I do want to note when I'm talking about transit, I'm talking about trains, buses, and last mile transit, which includes bikes and scooters. Currently, Montgomery County already provides a number of people free or subsidized transit. This includes children, seniors, people with disabilities, and recipients of temporary assistance for needy families or TANF vouchers who specifically request these vouchers. However, there is an important portion of the county that's excluded from these subsidies, and that is any low-income individual between the ages of 19 and 62 not currently receiving one of the subsidies that I just mentioned. So I set out to understand how means testing could bridge this gap. First, by conducting interviews with Montgomery County employees, then conducting a scan of existing programs nationwide, and lastly, conducting external interviews with stakeholders from these programs. I reached out to 14 programs and studies across the country. The programs who got back to me were the Bay Area, Salt Lake City, Utah, Boston, Massachusetts, our neighbor, Washington, D.C., as well as Alexandria, who I spoke with about their free fares program. Through these conversations, I identified 3 overarching best practices. The first of which, all programs utilized a predetermined eligibility cutoff, whether that be a percentage of the federal poverty line or eligibility for a social service. Next, all programs really prioritized ease of access to benefits. They did this through a number of things, providing materials in multiple languages, creating user-friendly websites and application processes, and even staggering costs of weekly and monthly passes so they don't coincide with bills, which are usually due at the beginning of the month. And last but not least, community partnerships are key. Many programs partnered with churches, schools, libraries, or county agencies such as Health and Human Services. The Bay Area hosted focus groups to better understand the needs of their target population. Additionally, our very own means-tested Capital Bike Share for All program travels around Montgomery County in a mobile kiosk to help people apply and identify different needs that aren't necessarily seen through online applications. These programs not only model best practices, but also show promising results. Boston's means-tested study found that this policy caused riders to take 30% more trips, specifically taking more trips to healthcare and social service providers. Which brings me to my recommendation, which is to implement means-tested fares for all low-income individuals in the county, including ride-on, Metro Bus, Metro Rail, and last-mile transit. I look at 2 eligibility and pricing models that the county could utilize in implementation. The first of which is qualifying for a social welfare program. By qualifying for one of the programs listed on the left, individuals would be eligible for means-tested fares. I explore 2 pricing models here, free low-income fares or half-off low-income fares. Next, I explore a tiered income pricing structure based on our very own call and ride program. Individuals whose incomes fall within levels 1 and 2 would receive free fares, while individuals that fall within levels 3 and 4 would receive 50% off of their fares. I do want to note I've been working with Department of Transportation on pricing out these models, and those findings will be included in my research. But it's important to note that means-tested fares will cost the county significantly less than free fares for all. It would cost the county $15.4 million to make ride-on and Metro Bus free for all riders. Means-tested fares would cost significantly less than this, though this would hinge on the eligibility criteria we chose, and it's definitely an area for future research. And with that, thank you so much for your time, and I look forward to your questions.
Great job. Very, very good start. So I'll just make a couple of comments and then see if any colleagues have any questions. Mr. Brooks, thank you so much for highlighting the arts and entertainment districts. I've always felt they are underutilized and not leveraged to the degree to which they should. I've mentioned this publicly before, but one of my favorite cities in the United States is Austin, Texas, which has really leaned into their arts and entertainment district designations, making it easier for there to be live music and festivals, and it has really, you can draw a straight line between that work and the economic development in that community and why so many young professionals want to move there. So you're really onto something there, and I do like the suggestion of the Arts and Humanities Council being more engaged, and I know Ms. Jenkins has actually mentioned that to us before and her interest in doing that, but needs capacity in order to be able to do it well. But I think it's something we should explore. And then, Ms. Brotman, so as the chair of the Health and Human Services Committee, I've been focusing, as all of my colleagues have, on trying to address the underlying issues that led to the stark health disparities during COVID. And one of the top 3 consistently across the board is access to transportation. So I think that you're really onto something there with the means-tested approach that reflects the reality of our fiscal challenges, but also the opportunity cost in not moving forward with that sort of an option. So great job to both of you. I've got 2 colleagues who've chimed in to speak. I'll start with Councilmember Katz, followed by Councilmember Rice. And colleagues, if I ask that you can, instead of the 5-minute rule, let's do the 2-minute rule so we can make sure we get through all presentations. Councilmember Katz.
Thank you very much, Mr. President. I'll try to come in under budget as I normally try to. First off, both reports are extremely interesting, and thank you for doing them. But on the transit, obviously transportation affects so many different areas, as you said, healthcare and everything else, and that becomes so very important. But in the other areas, whether it be the DC or wherever, Boston, did they involve trains and transportation that they don't directly receive revenue for?
Yeah, that's a great question. Thank you so much. I'll specifically focus on both Boston and DC because the DC randomized control trial that they're about to undergo implementation is directly modeled based on Boston's program. So yes, both of those did include trains in their model, as did the Bay Area and Salt Lake City.
And I'm assuming that the trains were not under their revenue. So that means that the entity, the municipality, actually took money from their budget and sent it to another entity. Is that what they ended up doing?
Yes, that is correct in the case of both Boston and DC. In the Bay Area, which conducted a region-wide transit agreement with over 20 regions and counties in the Bay Area, some of that money was actually funded by the transit systems themselves. But in the case of Boston and Washington, D.C., you're completely right. That was funded by the local governments.
All right, thank you. Very good report and very thought-provoking. Thanks.
Thank you. Councilmember Rice, followed by Council Vice President Glass.
I promise I'll be quick. Ms. Brotman, thank you very much. Your recommendation's spot on. I think that, again, we struggled with that in this budget cycle on what we wanted to do in terms of how to move forward when it came to equitable transit access. So I just really appreciate that. Mr. Brooks, as chair of the Education and Culture Committee, this is something we've talked about for a very long time in terms of efficacy, and it's one of the things that I mentioned to Councilmember Friedson, who used to work for our comptroller, and we know all too well about how oftentimes so many tax credits go unutilized, mainly because people just don't know. And I think that having our Arts and Humanities Council at the forefront can help, because they're at the, right there with our artists, helping them each and every day on all the different things, and can encourage them to utilize this, but also to make sure that we're making better practices of how we're promoting our arts throughout the country. I just came back from a conference in Denver to where there's a very vibrant arts and entertainment district all throughout. In fact, spreading beyond just Denver into Aurora and other kinds of places as well, where we're really starting to see that take hold. And so from that standpoint, I think that your recommendations are spot on, and we certainly will, as the Education and Culture Committee, make sure that we're taking those up as recommendations when we return in the fall. So thank you.
Thank you. Thank you both. All right. Oh, Council Vice President Glass, my fault.
I'll be quick. Thank you, Mr. President. Mr. Brooks, thank you for the presentation. I think sometimes for a while, there has been a perception that the A&E districts are there for the utility of some of the larger organizations. And I think that your research has shown that that might be true, and that we have a lot of work to do to really help the smaller and independent artists and organizations that we know are there. We just got to spend some time digging and highlighting. So thank you for that information. And Ms. Brotman, thank you for your presentation. I'm glad that the Department of Transportation worked hand in glove with you as they undertake their reimagining ride-on. And this information and the project will live on as we take that up over the next year or two as well. But I think the highlight of what you shared, and it hadn't been conveyed to me in just this way, is that 40% of our residents are already eligible, right? We're almost there. We can get there. Thank you.
Thank you. Great job. Next two presentations.
Good morning, council members. My name is Natalie Kirsch, and I'm a current Master of Public Policy student at Georgetown University. And today I'll be presenting on assessing racial equity and social justice in Montgomery County Green Bank programs. The impetus for my research is really Bill 4421, which is effective as of this month. And it's really enabling the County Green Bank to scale up its programs by providing them 10% of the fuel energy tax annually, which for this year is projected at around $17.6 million. And with this bill came 2 requirements to encourage equity through Green Bank projects. The first is that 20% of funds must support activities in equity emphasis areas. And the second is that 15% of funds must be used to reduce the cost of energy projects. And what this really means for the county Green Bank is that they're going to need to begin reporting metrics to first understand if their programs are in compliance with Bill 4421's requirements, and second, as they scale up, to really enable them to understand if the Green Bank is helping the county to reach its broader environmental and racial equity and social justice goals. In terms of methods, I really focused on researching best practices in reporting from other American Green Banks. In particular, I looked at the Connecticut Green Bank, the New York Green Bank, and the California Green Banks. And what I really wanted to understand was what metrics they were reporting to enable them to better understand and incorporate racial equity and social justice into their programs, and to help them with program evaluation more broadly. And in terms of sources, I really looked at annual reports and other kind of public materials. 2 examples that I want to highlight for you from my findings. The first is from one of the California Green Banks, and they do a good job of breaking down who's benefiting from their programs. So this example is looking at who's benefiting from programs broken down by census tract income level, and specifically they looked at kind of percentages in relation to area median income. And a second idea that came out from my research was this mapping analysis of your area tool, which is a really cool data visualization tool from the Connecticut Green Bank. And here I'm looking at investment details broken down by census tract areas, since that more closely corresponds to the equity emphasis areas in Montgomery County. And what this lets you do is look at who's benefiting from projects, where these people live, and what their income levels are in relation to the area median income level. And then on the right is this cool data output, which could be used for future research. In terms of Montgomery County Green Bank's current reporting, they do a great job of general reporting, so things like annual greenhouse gas reductions, counting the number of households they support, and which households among those are low and moderate income. And soon they will also have to update their reporting in accordance with Bill 4421. However, I'm recommending that beyond Bill 4421 requirements, the County Green Bank report the following to provide them a better, more detailed picture of racial equity and social justice impacts of their programs. So the first is I'm recommending breaking down the number and percent of projects and total funds by demographic characteristics of beneficiaries. And the second is to break down the average interest rate of loans by demographic characteristics and FICO scores of loan recipients. And the reason behind these metrics is first recognizing that BIPOC and low and moderate income individuals live throughout the county and not just in these equity emphasis areas. Second, to really ensure that benefits from their projects are accruing to secondary beneficiaries. And what I mean by that is that a lot of projects are structured so the loan recipients are home and business owners. And we really want to make sure that programs are trickling down to renters and other secondary beneficiaries. And third, these actions would really enable Montgomery County to be a local leader, not just in terms of having a Green Bank, but in terms of integrating racial equity and social justice in the Green Bank's activities. So thank you very much for letting us present today, and I look forward to your questions.
Thank you, Ms. Kirsch. Next, we will hear from Mr. Matias.
Good morning, council members. My name is Isaac Mathias, and I am a summer fellow and a master's of public policy student at the University of Maryland. And today I'll be talking about how we can prevent evictions from occurring in Montgomery County. And so to begin, a little context for eviction trends in the county is that in 2018, the Office of Legislative Oversight released a report on evictions in the county, creating this comprehensive explanation of the eviction process with recommendations and findings. However, much has changed since 2018, most notably the COVID-19 pandemic, which significantly increased the population who are vulnerable to evictions in the county. But it also brought about eviction prevention resources that were strengthened to a degree that we had not previously seen. And because of this shift in the landscape, it's important to re-examine the context in which evictions operate in the county. So, as can be seen in this graph, evictions in fiscal year 20 and fiscal year 21 substantially decreased from previous fiscal years. From 19 to 21, there's a 77% reduction in total evictions. And this trend can be largely attributed to the government interventions made by these various levels of government. For example, the rent cap in Montgomery County, the federal government's eviction moratorium and increased financial rental assistance, and recently the state of Maryland implemented a new law that creates a right to counsel program for eligible tenants, and it requires landlords to provide a 10-day written notice prior to filing an eviction. However, some of these protections have expired or have diminished in strength, creating a potential wave of evictions, which we can see starting to begin in fiscal year 22. I attended housing court a couple of weeks ago to observe, and they were just now getting to failure to pay rent cases from November of 2021, which was immediately after the eviction moratorium was struck down, showing that there's an immense backlog. And so ultimately, this fiscal year 22 eviction level seen here is just the beginning of what may become a very large wave of evictions in Montgomery County. And so in examining ways to prevent evictions from occurring, I looked at general best practices from experts on the subject, as well as what innovative and surrounding jurisdictions have done to prevent evictions. And in creating successful eviction diversion programs, experts point to the 3 A's and intervening upstream in the process. These 3 A's are access to free legal counsel, assistance such as rental relief or other social services, and alternatives to court such as landlord-tenant mediation. And what's really great is in Montgomery County, tenants can access all 3. However, where Montgomery County falls behind a bit is intervening upstream, where experts state that an intervention upstream in the eviction process, specifically before an eviction filing occurs, is most effective in preventing an eviction. And so in looking for innovative jurisdictions, I utilized trusted sources and selected a range of policy approaches to preventing eviction. And from a wider grouping of innovative jurisdictions, I want to particularly focus on Philadelphia and Syracuse, each of which have upstream interventions where the landlord initiates the intervention. Philadelphia's eviction diversion program requires landlords to seek out landlord-tenant mediation and apply for rent assistance before being able to file for an eviction. Syracuse, New York implemented pilot programs in 2 different developments where property managers, before filing for an eviction, must contact either the Syracuse Housing Authority or Catholic Charities, who then can reach out to tenants who and assist them as they need it. And both of these programs have had immense success. In both cases, there's been over 75% reduction in both evictions and eviction filings. And in Syracuse, both the city and property managers saved hundreds of thousands of dollars. And so this brings me to my recommendation for Montgomery County. And my recommendation is twofold: that we move the intervention point upstream and we shift the onus away from the onus to seek assistance away from tenants. So as the state of Maryland recently required that landlords give a 10-day notice to tenants who have failed to pay rent and are at risk of eviction, Montgomery County has this perfect intervention point in which they can require landlords to report those who are receiving these notices to the Services to End and Prevent Homelessness program. This program can then reach out to those at risk of an eviction and assist them as needed. And by doing this, Montgomery County would create a more effective intervention as it is upstream. It shifts this onus to seek assistance away from these people who are in crisis, and it utilizes these aforementioned 3 A's that are already accessible in the county, which would ultimately prevent evictions from occurring. So thank you very much, and I look forward to any questions you may have.
Well, the hits just keep on coming. Those were 2 very impressive presentations as well. I'll just make a couple comments here as well, and then I've got a couple colleagues in the queue. Ms. Kirsch, just your presentation resonated with me for a lot of different reasons, and you're correct, there are numerous examples of pockets of poverty within even some of the most affluent zip codes that we have in Montgomery County, including in Potomac, that need to ensure eligibility for programs such as the Green Bank, and that they're not disadvantaged in any way just because they may fall outside one of these larger areas of need. So it's a very point well taken. And then, Mr. Matias, I really appreciate the thoughtful approach with which you have made recommendations to tackle what we know is a growing issue. And I think many of those recommendations are infinitely reasonable, and ones that we absolutely should fully explore here as well. So thank you very much. I'll turn it over to Councilmember Jawando, and then Councilmember Friedson.
Thank you, Mr. President. Agree, these are great presentations. I had the benefit of seeing you all yesterday, so I kind of got a little sneak peek, but you're not disappointing. And the point that both of you brought up, these are related. I know we didn't pair these on purpose, but we talked about and you discussed the need for diving deep, as the Council President just mentioned, in communities to realize where there's need. And we use these markers of equity emphasis areas, which are good, but I think we need to push ourselves, and I challenged you to help us push ourselves to find better ways to drill down with the data. And on the eviction crisis, I really appreciate the recommendations and the acknowledgement of the policies that we put in place to help stem the tide. And I'm really glad that you're able to experience and go to court and see, unfortunately, what's happening and increasing. Did you do any research in relation to how our sheriff's office interacts with services to end and prevent homelessness as far as the notifications? When you looked at, because when I saw that Philadelphia law, I don't think, I agree with you, shifting the onus is good, but as far as the notification timeline, did you look into our notification timeline before making these recommendations at all?
The notification timeline is so far as
go ahead, I'm sorry.
When landlords are notifying the tenants.
Correct.
Or when so the notification timeline, the 10-day written notice is newly implemented by the state of Maryland. So I don't think there's much data currently on how that has changed too much. Maryland previously was pretty unique in that it didn't require that timeline prior. Most states have either a 5, 10, or 30-day written notice.
And what was the Philadelphia one? Was again?
I'm not sure what the Philadelphia.
That was one of the examples you cited, right?
Yeah. So Philadelphia, how it works is that when a tenant has failed to file for an eviction, they have to. The landlord the landlord must sign up for landlord-tenant mediation and rent assistance. So then those resources and so once the landlord-tenant mediation has completed or the rental assistance has been given, then they are able to file for an eviction. So there's not necessarily a number of days before they can file for an eviction.
Got it. Yeah, well, certainly something to look into as we're trying to have a whole set of services to keep people in their homes. So kudos to both of you, and thank you for your work. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Well, echo everything that has been said. Just the breadth and depth of work here is really remarkable, and we're just lucky to have you join us and to really dive deeply into these issues. I really appreciate, Ms. Kirsch, you're looking into this big question that we had as we were legislating on that bill on 4421, where we're talking about this historic investment that we're making to reach our environmental sustainability and climate reduction goals, and try to incorporate our racial equity and social justice goals within it. However imperfect some of those solutions might be, and certainly equity emphasis areas that Councilmember Navarro worked on at the Council of Governments are a huge step forward, but are an imperfect solution. So I really appreciate you looking at what are better ways to collect data. We have talked a lot about the disaggregation of data as we grapple with all the major public policy issues that we've been facing, particularly during this pandemic, and certainly will be helpful in this regard. I just was curious if there were other jurisdictions that you looked at that collected similar data, either through a green bank or some similar mechanism. Green Bank is giving environmentally focused financial, support, but there are, I used to work at the, serve on the Maryland Small Business Development Financing Authority, also gives loans, just not particularly for what the Green Bank does. I was just wondering if there are any jurisdictions currently that provide loans or other financial support that does this data collection well already that you found in your research.
Yeah, so in terms of green banks, the best reporting I saw was from the Connecticut Green Bank, and the way they defined their kind of equity emphasis zones was as a combination of environmental justice areas, which was similar to equity emphasis areas, as well as a more broad measure of people's income levels in relationship to the area median income, and they kind of grouped them together and had a goal of 40% investment in these communities. And then to answer the rest of your question, in addition to looking at green banks, I also looked a little bit at CDFIs, or community development financial institutions, and some of them had pretty strong reporting.
Great. Okay. Well, it's good. It will help us to look at what others are doing to help us move forward. So I really appreciate that work. I think there's some terrific recommendations. And Mr. Mathias, just really appreciate your work here. It's good for us to look at what we do well and then where we could be better. And I think you noted both, and I think it's really helpful. You provided us some really good, very actionable and specific with the 10-day notice requirement, the opportunity to do something there. So thank you so much. Appreciate everybody's work.
Thank you. Councilmember Navarro will get the last word on this group.
Thank you. Thank you, everyone. It's very impressive. And I really appreciate, Ms. Kirch, the way that you went much deeper into this issue. Guys, I think we're here when we were discussing the regulation for the racial equity and social justice law. And so this is an example of how we're trying to figure out how to best support the council and the administration in this work. And so even though we require equity impact notes analysis for each piece of legislation, land use, the TAs, and budgetary decisions, it's one thing for the council to receive that impact note, that analysis, but then it's like, what are we going to do with that? Right? What could be some ways that we can address those issues? And so fortunately, we also built a position within the council, Ms. Singleton, so that she can then look at these types of best practices. And so when the council is faced with a decision like this, we can then have the benefit of all that research. And so what you presented, I think it's a really wonderful proposal for our council staff to take a look at, because it is applicable in so many other ways, and it goes a lot deeper as well. So I really appreciate that, because it reminded me of how we are trying to connect all these dots as we are embarking in a much broader effort with racial equity and social justice that cuts through across all the policy areas that we have to legislate on and make budgetary decisions. There is a need to understand how we can best approach it, because it's not readily available as well. So just kudos, and I think all of the presentations have that particular thread regarding how we can take advantage and also utilize a lot of that type of analysis to help us then again implement with fidelity this very important act. So really thank you. You guys have really gone into areas that we can all really utilize in the future.
Thank you. Great job. All right, we're halfway through. The next two presentations, we'll go to Ellie Nicolopoulos.
Good morning, council members. My name is Ellie Nicolopoulos. I'm a Master of Public Policy student at the University of Maryland. And for my project, I interviewed childcare providers in the county to better understand how new state-level regulations would affect their ability to provide childcare for low-income families. So for background, the Blueprint for Maryland's Future was passed recently by the Maryland General Assembly, and one of its major goals is to establish free pre-K for all of 3 and 4-year-olds who are under 300% of the federal poverty line. And the way it proposes to do this is to provide grants directly to both public and private providers, depending on the number of students under this income threshold that they enroll in their programs. However, to qualify for these requirements, providers must meet, or to qualify for the grant, providers must meet certain requirements. There are several, but I'm going to focus on two major ones.
The first is they currently have to be rated at a Maryland Excels level 3 with a plan to achieve 5 within 5 years. Maryland Excels is a quality rating system used throughout the state based on nationally recognized standards, and the higher the level, the higher the quality. The second factor is around the education level of childcare workers. So the law establishes that teachers must have a bachelor's degree and a MAP program completion or a pre-K through 3 state teaching certificate by fiscal year 2026, and teaching assistants must have an associate's degree or a child development associate certificate by fiscal year 2026. All of these requirements must be met by providers in order to receive funding under the blueprint. These requirements effectively work to limit the supply of childcare that is available under the blueprint funding, and that poses barriers to low-income families who seek childcare under this legislation. In interviewing providers, I found a lot of common threads, and I will cover some key themes. The first is that providers simply lacked awareness of blueprint requirements. They had heard of the legislation, but they weren't sure of the specific requirements they would have to meet, and so they could not take action to meet these requirements and serve our target families. The providers I spoke with also don't currently enroll students who meet the income requirement, and so they didn't see any incentive to make program quality improvements in the case that in the future they would serve low-income students. The one provider I spoke with who does meet all of the requirements said that they have a waiting list that begins before a child is born, and so the chance that they would be able to enroll low-income students was very, very low, simply for capacity reasons. The education requirement was seen as especially restrictive by providers. Childcare workers would have to work full-time and go to school part-time, and the average rate of degree completion takes about 10 years part-time for childcare workers, so a turnaround by fiscal year 2026 is very unrealistic for their timeline. And the grant amount is currently, for this fiscal year, at around $10,000. The average cost of care in the county, depending on the type of care, can range from $14,000 to $18,000, with care over $20,000 by some providers. So the grant amount does not cover the full cost of care, and we'd expect that low-income families would have to pay out of pocket the remaining costs. These maps show how much the requirements limit the supply of childcare just under the Excels requirement. Neither the state nor the county have a workforce registry, so we're not sure how many teachers meet the education requirements. So I'm going to be focusing on the Excels. As you can see, only about 25% of county providers currently qualify at a level 3 or above, and this does not take into account, again, the education requirement, nor does it take into account capacity concerns. So they might qualify under this requirement, but not have open seats to enroll low-income families. If we maintain a status quo and we look at providers who currently have an Excels level 5, that leaves only with 7% of county providers who in 5 years would be eligible for the blueprint requirement. It might be the case that some providers are able to reach Excels level 5 in that timeline, but we're not sure since the incentives are not there. Given these findings, I recommend that the county work to raise awareness of providers and assist them in meeting these requirements, work to generally increase the supply of childcare available to all families, but especially low-income families, and advocate for state-level changes to the requirements and timeline so that we can better provide childcare for all of our low-income families. Thank you.
Thank you. Great job. Next, Ms. Pearson.
All right, good morning. My name is Nell Pearson. I'm a Master of City Planning student at the University of Pennsylvania, and today I'm going to be talking about food scrap recycling and composting capacity within Montgomery County. In 2020, over 98,000 tons of food waste were disposed of in the county. This represents a major opportunity to divert this resource via a process called composting. Composting effectively transforms organic waste into a nutrient-rich soil amendment. This process can help to reduce greenhouse gas emissions, create green jobs, and support the county's ambitious climate goals. Organic waste management is a place-based industry. This means it's most effectively done at the local level. Montgomery County is really already a leader when it comes to recycling efforts of both inert materials, so that's paper, glass, and plastic, as well as yard waste. Additionally, there is currently a curbside pilot program in order to collect food scraps, so that's also rolling out as well. And if food waste recycling initiatives are to scale in the county, there is a need for increased capacity. This presents an opportunity for the county to consider creating its own food scrap recycling facility. Looking at the regional composting facilities that are currently in operation, only the DevCo Bioenergy facility falls within a 30-mile trekking radius of the county's waste transfer station. That curbside pilot program that I mentioned earlier is additionally bringing its food scraps to PG County at this time. A county-owned facility could help to ensure capacity going forward and reduce waste hauling expenditures. Siting a composting facility can be quite challenging. The site should be close, within 50 to 75 miles of where food scraps are being created, but not directly in densely settled communities, so often compromise is needed in order to make the best of what's available when choosing a site. Some communities might view a composting facility as an unwanted land use, and there are fears of negative externalities like vermin, increased odor, increased truck traffic. A lot of these can be actually controlled with best management practices on site, so it's really critical that there's community engagement from day one. Additionally, there are local and state regulations that the site would have to abide to in order to uphold human and environmental health and safety. So my report will include an inventory of parcels that would be suitable for a composting facility. The map on the right represents a preliminary review with best practice criteria. It shows that there's potential for a central composting facility in county. The parcels in red are privately owned, the parcels in green are county-owned properties, and they're within a 20-mile trucking radius of the transfer station. Additionally, within the report, via interviews with compost facility operators and other relevant stakeholders, I'm compiling community outreach standards when it comes to siting a facility. There are a few challenges to consider currently in terms of infrastructure in Montgomery County when it comes to food scrap recycling. The transfer station is already experiencing limited capacity, so additional feasibility studies will have to be conducted in order to determine how food scraps might be processed on site or elsewhere. The yard trim composting facility does theoretically have room and the resources to process food scraps on site. However, this is not currently permitted under the Agreement of Settlement and Compromise with the Sugarloaf Citizens Association. Site 2, which is a county-acquired property that is permitted for landfill use, could potentially be explored as well for food scrap recycling. However, there are significant limitations. For example, a road would have to be built in order for this to be a viable solution. Thinking more broadly about food scrap recycling, community buy-in is very important. It's generally assumed that there are lower participation and capture rates, so continued education is really critical. Next steps for the county include bolstering existing initiatives to support local composting, expanding the food scrap pilot program if it's determined to be successful, and conducting further feasibility analyses in regards to the necessary technology and siting requirements for a facility. Despite the current challenges and limitations, food scrap recycling is really a fantastic opportunity for Montgomery County to continue to lead in recycling efforts and meet climate goals. Thanks so much for your time.
Great job, both of you. There were a lot of heads nodding towards the end of your presentation there regarding food scrapping and available locations and facilities. And this is an area where there's a huge opportunity for growth in the county. I mean, we're starting basically from square zero. I just had a couple friends visit from Canada, and they are so light years ahead of us when it comes to composting. It's not even funny. So thank you for that, and really appreciate the work done around childcare and the deep dive there, which is not just a moral but economic development issue too, and so a really important one. I've got Councilmember Navarro.
Thank you. This was great. Both amazing presentations. Just a question with Ms. Nicolopoulos. I really appreciated your analysis. It's so spot on. It is one of those situations where there's always this conundrum of trying to promote quality childcare, but then you kind of set yourself up for failure because the requirements are so extreme that then providers are not able to meet it, and then those who suffer the most are usually low-income families. And so that has been a real concern with the blueprint from the very beginning. So I appreciate how you were able to really hone into that and get that feedback. I was wondering if you were able to look at the county's early care and education initiative. It was a plan, a 4-year action plan that I authored in 2019 and the council adopted. You know, we put a lot of funding precisely because of that issue, trying to expand the availability of quality childcare, especially in areas where you didn't have any. So I was curious whether you looked at that and whether you were able to discern if there were some additional things that could be done, especially now that we just passed the bill where we created a coordinated entity, an early care and education entity, which was really like the culmination of this effort. But that was kind of like the purpose, at least when I was, when I put this forward, it was how can we best really target this effort towards making sure that quality early care and education is everywhere, right? So we're not remediating children when they enter kindergarten, right? So were you able to take a look at that, and do you have any thoughts on where you think it could be expanded or improved?
Yeah, I did take a look. I think it's an excellent start, and I really appreciate especially the effort for the coordinating committee. I think that's going to be key in terms of outreach to providers and raising that awareness and really honing in on what they need in order to meet these requirements. And I really appreciate that effort. I think a significant part of my recommendation is advocacy to the state to extend the timeline. I think that's something that the county could do, is write an advocacy letter, because right now the turnaround is just not realistic for our providers. And if we do want them to get to these educational attainment goals, I think they're excellent, but I think we need to give them more time and more assistance. I think we could also look at additional incentives to take on low-income children. As I mentioned, the grant amount from the state is lower than the cost of care, and so if it met the cost of care or even exceeded it, providers would have additional incentives to take on those children, and we'd see less of an achievement gap or a service gap in terms of income.
Awesome, yeah. And I think mostly from my colleagues who are going to be coming back, there are some really great opportunities to do what you was just describing of how can we incentivize and then leverage, because a lot of the childcare providers, especially family childcare providers, when you look at the demographics of it, it is obvious that there's going to be a need for some type of additional assistance, so whether it is to fulfill those educational goals or whether it is to set up your program and things like that. That is something that I think future councils, next term councils, et cetera, should start to look into to provide that kind of direct financial assistance in order to mitigate the requirements that are coming down through the blueprint. So I think that's really spot on. Thank you so much.
Thank you both. Those were excellent presentations. We're going to move on to the last two presentations. We next have Gwen Payton.
Good morning. My name is Gwendolyn Payton. I'm a second-year Master of Public Policy student at the University of Maryland, and I did my project on telehealth expansion at Montgomery Cares Clinics and the impact on limited English proficiency patients. Telehealth is the use of communications technology to access healthcare services or to manage healthcare. Its original expansion during the COVID-19 pandemic was due to its ability to serve as a means of infection control. However, virtual appointments continue to constitute a far larger share of overall appointments than they did prior to the pandemic, because telehealth offers a number of benefits that make it attractive to both patients and providers. Namely, it reduces or eliminates many access barriers, including the need for childcare, a need for transportation, especially personal transportation, and a need for paid time off work. However, it also introduces some new access barriers, including a need for internet access and appropriate digital technology at home, and an understanding of how to use digital or virtual platforms. The people most likely to have problems accessing telehealth also have the most to gain from reduced childcare, transportation, and time costs. For example, low-income people who lack paid time off or personal transportation are also more likely to not have internet at home. Past reports from the Office of Legislative Oversight and the Primary Care Coalition document high levels of satisfaction with telehealth services, but also call for additional investigation onto the impact on certain populations, including LEP patients and older patients. Barriers to telehealth access among limited English proficient patients are a function of both language access and digital technology access, and these two issues compound one another. Patients with limited English proficiency are less likely to have internet access at home, and many patient-facing applications are only available in English or have poor translations available in other languages. As a result, some evidence suggests that limited English proficient patients are less likely to use telehealth services, and it reduces overall telehealth or overall healthcare utilization. In San Francisco, primary care clinics saw a 50% reduction in total visits from patients with a non-English language preference after the implementation of telehealth appointments during the COVID-19 pandemic. To conduct my research, I began by reviewing state and federal frameworks for culturally and linguistically appropriate services to establish baselines for best practices, and I conducted interviews with Montgomery Cares clinics and with some county contractors that provide interpreters and integrated services to limited English proficient individuals. So for my presentation, I would like to focus on my interview findings. Different communities were impacted differently by this medium of care. Older limited English proficient patients and patients from language groups that are less populous in Montgomery County faced some additional barriers, while communities where many patients lacked personal transportation, paid time off, or had young children saw some new opportunities among those who were able to access telehealth appointments. Perception of language access barriers and digital technology access barriers varied widely among those who I interviewed. Some contractors demonstrated greater familiarity with access barriers than clinics did, and some clinics showed more awareness about access barriers than others. For example, one clinic had procedures in place to facilitate appointments with patients who had limited digital literacy, while others did not have any such procedure in place. Addressing access barriers in telehealth services also requires addressing some baseline language access issues. Language access at Montgomery Cares clinics that I spoke with were generally in line with minimum requirements for services, however, did have some room for improvement to better reflect best practices. Most clinics lacked provider-side evaluations, and providers also expressed a need for additional monitoring of future language needs. One clinic brought up a difficulty locating Pashto-speaking interpreters when the clinic received an influx of patients from Afghanistan. There were also some deficits in the capacity of the workforce to meet patient needs overall. So one interpreter reported dealing with repeated budget cuts, which resulted in them not being able to offer raises to their interpreter staff. So their interpreter staff's hourly wages were below industry average. Additionally, a theme that came up consistently is that interpretation services are critical but are not a substitute for a diverse workforce of healthcare providers who understand their patients' cultural context. Montgomery County can address telehealth barriers to limited English proficient patients at clinics by first addressing overall language access issues and then by addressing digital technology access barriers. To address language access, Montgomery Cares should implement a systematic evaluation of language access programs at community health centers, increased monitoring of future language needs, train providers on access barriers and culturally and linguistically appropriate service standards, and invest in a multilingual and multicultural healthcare workforce. To address issues of digital technology access, the county should support health initiatives, community partners, and clinics in developing materials in target languages with special attention to less populous language groups, analyze the characteristics of telehealth and non-telehealth patients to understand disparities, and identify best practices for facilitating appointments with limited digital literacy patients, and train clinics in those best practices so that they can facilitate appointments with patients who want them when telehealth is appropriate. Thank you.
Thank you. And last but certainly not least, Gabriel Terrell.
Hello, thank you. My name is Gabriel Terrell. I'm a dual degree Master's of Public Affairs and Urban Planning student at the University of Wisconsin-Madison. Today I'll be speaking with you on equitable transit-oriented development in Montgomery County. ETOD helps ensure that development near transit corridors supports the overall quality of life, as well as equitable outcomes for area residents of all incomes and backgrounds. Components of ETOD are displayed here by the City of Austin, who is currently working with the community to develop plans for ETOD to be implemented in the next 2 years. I'll focus on 3 components: high-frequency transit options, walking and biking connections to transit, and affordable housing for a diversity of families and individuals. These are components of ETOD infrastructure that could be integrated into planning to support Montgomery County BRT corridors. The City of Chicago underscored the need for ETOD, having studied TOD development between 2016 and 2019, and found that nearly 90% of new TOD projects were focused on the north sides, whereas only 10% of TOD occurred over the entire south and west sides. So, in response, last month, Chicago introduced its first ever ETOD ordinance. Montgomery County could develop ETOD policies with Chicago's ordinance in mind. In fact, Montgomery County has already begun to implement ETOD policies around the Purple Line corridor towards 3 goals: developing affordable housing, providing loans to small businesses, and expand community engagement to develop common ETOD goals. Their ETOD metrics could be scaled to BRT corridors in Montgomery County. For example, the Veers Mill corridor on the left here was Montgomery County's first master plan to adopt Vision Zero policy. It also called for a complete streets retrofit, envisioned here in the middle. But Veers Mill is a unique opportunity to look beyond just the BRT corridor and complete streets to the quarter mile around the BRT station to increase affordability to support Montgomery County's moderately priced dwelling unit, MPDU program that was the first successfully implemented inclusionary zoning program in the country, seen here in MPD rental units in blue within parcels a quarter mile around the Wheaton and University Avenue planned BRT stations. Here we see the same area from the previous slide to underscore the potential to increase affordable housing units alongside future development using Montgomery Planning's residential density capacity analysis tool to examine the total potential residential development capacity. ETOD overlay zones also have the potential to increase the number of affordable housing units. Raleigh's ETOD guidebook introduces a mixed-use and residential overlay zones within a quarter mile around their BRT stations to increase affordable housing units. Montgomery County Planning's neighborhood change analysis provides yet another key reason in favor of ETOD that found building new housing has played a critical role in encouraging neighborhood diversity and in promoting inclusive growth, here shown in the shades of yellow or green along the Veers Mill BRT corridor. By contrast, neighborhoods that added the least new housing saw either displacement or intensified poverty concentration, here shown in shades of purple or pink. Here we see within the blue outlined areas, equity focus areas, EFAs, along Veers Mill Road that underscores the need for ETOD, as EFAs are identified areas that may experience the highest inequities in access to transportation, job opportunities, and other resources supporting a high quality of life. So in sum, I put together this policy matrix, the policy alternatives that I've been recommending so far in the presentation. First is looking at a long-term vision for Montgomery County's ETOD, integrating ETOD into a functional master plan for overlay zones. A short-term vision is for Montgomery County's ETOD might be to study or pilot ETOD overlay zones like Raleigh or Austin. And third, fund existing ETOD in Montgomery County. Scale the Purple Line Collaborative's ETOD best practices in Montgomery County's BRT expansion. And fourth, create an inclusive BRT station geography, looking beyond the corridor to the quarter mile around BRT in ETOD areas. And of course, looking at policy goals for these recommendations. Are there any comparable costs? Well, we do see those in Austin, Raleigh, and Chicago. And do all of these alternatives have efficacy to achieve the ETOD components? Very likely. And third, with the policy recommendations, do they provide benefits to BRT for all income levels? And yes. So thank you, and appreciate your questions.
thank you both. Just a couple comments here as well. Ms. Payton, you're spot on. This absolutely is going to be a critical component to addressing some of those public health disparities, in addition to the connection to transportation that we discussed earlier, which really go hand in hand. And the Mary Center in particular has been doing some really innovative work at the local level, and the data that you gathered is consistent with what they found as well. It significantly decreased the no-show appointments and helped expand and leverage the resources into more multicultural communities. But the key is ensuring that there's quality translation and that there's technology available on the patient side too, as well as the medical offices, which are not always adept and have the necessary framework to really be able to take advantage. But you're really onto something, and I know that you spoke to Beth Schumann in my office about this, and really excited about following up on your recommendations. And Mr. Terrell, your recommendations are also very timely, as we're in the process, as you know, of deliberating Thrive 2050 right now. And so I think you can draw a straight line between some of your recommendations and some of what we are discussing at this very moment. And it's appropriate that Ms. Dunn was helpful to all of you, because she's been such a leader in helping the council shepherd through this really important process. But housing remains, and accessible and affordable housing remains the biggest issue that we have to tackle among many, but the one we heard the most about, especially during this last election cycle. So kudos to both of you. I don't see any other questions or comments from colleagues. We've got a crazy busy day today, but let me just conclude with this thought. Keep going. Thank you for choosing this profession of public service. It's never been more important than right now. And there are, I will say, a number of vacancies here in Montgomery County. And we need a lot more talented people like you. There will be 6 new members of this body who are going to be looking to fill out their teams. And there's a lot of turnover that we're seeing in both the executive branch, within park and planning, and at all levels of government. So the time is ripe for you all to be able to step in and show the leadership that you showed us this morning. So thank you all very much. Congratulations. One more round of applause. All right, we move on to the next item on the agenda, which is legislative session, day number 21, introduction of bills. And we begin with Bill 2322. This is Personnel and Human Resources, amount of pension, Group B members. The lead sponsor is myself at the request of the county executive. A public hearing will be scheduled at a later date. The Government Operations Committee work session will be scheduled at a later date as well. Ms. Wellens, if you could just briefly describe this item.
Thank you very much, Council President and Council members. Good morning. Bill 23-22 is the result of collective bargaining between the county executive and IAFF. And as mentioned, it would increase the pension amount for Group G members by applying 5% of average final earnings for each year of credited service received for accumulated sick leave, subject to a certain reduction amount. And as the Council President mentioned, this will be scheduled for public hearing and also referred to the GO Committee. Thank you.
Thank you, Ms. Wellens. So Bill 2322 is now officially introduced. That takes us on to the next item, which is Bill 2422, Streets and Roads. Once again, the lead sponsor is myself at the request of the county executive. Public hearing is scheduled for this one on September 20th at 1:30 p.m. The Transportation and Environment Committee work session is tentatively scheduled for October 10th. Ms. Nadeau, could you briefly describe this item?
So this bill is part of the Complete Streets package, which actually includes a ZTA and an SRA as well, which will be reduced in a few minutes, it looks like. So the Complete Streets Guide is a policy and design guidance from that planning and DOT worked on. It's all about the operation of our county roadways. So it's going to apply some more standards consistent with Vision Zero, as well as reclassifying some of our roadways. So the entire package is going to go to the T&E committee all at the same time.
Great, thank you. So that bill 2422 is now officially introduced as well. That takes us on to the next item on the agenda, which is item number 6, call of bills for final reading. We begin with Bill 422, human rights and civil liberties, public accommodations, gender-inclusive restrooms. There was a joint government operations and HHS committee work session on this, and we recommended enactment unanimously with amendments. I'll turn it over to the lead sponsors of this bill to make some opening comments, and Ms. McCartney Green to walk us through the packet. So, Council Vice President Glass.
Thank you, Mr. President. I want to thank all my colleagues for co-sponsoring and expressing their support for this legislation as we, engage locally in what has become a national conversation about making sure that everybody feels welcome and safe in their own communities. We are taking this additional step to make sure that people feel welcome and safe here in Montgomery County. And this legislation will allow individuals to use single occupancy restrooms regardless of their gender identity, and also make sure that families with small kids and individuals with disabilities and caregivers can also use those public accommodations, recognizing sometimes we all have to wait outside a restroom and there might be another one that's available right next door. And so this is really going to help everyone in our community, the entire public, and look forward to getting this passed today. Thank you.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. The Vice President truly said it all. This is and it did get confusing for some, I guess, during when it was initially introduced. This is for single-user restrooms. It involves caretakers and parents. It involves the way that we should do accommodations the correct way for single-user restrooms. So I appreciate the committee's recommendation.
Thank you. Ms. McCartney Green.
Thank you, Council President. And just to sum up, the GOIN HHS Committee did recommend approval of Bill 422 with amendments. And there were 3 amendments. The first one was to modify the definition of gender-inclusive signage and align it with the proposed state definition as outlined in Senate Bill 486. The second amendment was to amend the line 16 of the bill to update the definition of public single-user restroom to state at least one toilet instead of using the word one water closet. And lastly, the final amendment was to clarify in Chapter 27 of the County Code that a restroom other than a single-user restroom remains outside of the scope of the county public accommodation law. With that being said, Mr. President, this bill is recommended for enactment for today.
Thank you very much. I'm going to turn it over to Chair Navarro, who did chair this joint committee session. Chair Navarro.
I don't have much more to add. I just want to thank Councilmember Katz and Glass for introducing the bill. I think that we had a pretty robust conversation during the joint committee session, and I'm glad that we are here right now to vote.
Thank you very much. And so I don't see any other questions or comments from colleagues. We have a joint committee recommendation, so we can now go to the roll call.
Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Joando?
Yes.
Mr. Joando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. And Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
Let the record show that passed unanimously. We now move on to the second bill, which is Bill 1022, Personnel and Human Resources, Paid Parental Leave. There was a joint committee recommendation of the GO and HHS committee to enact with amendments. I'll turn it over to Chair Navarro, who I apologize for not turning first on the previous item, who chaired this important discussion as well. Chair Navarro.
No problem. Okay, so this Bill 10-22 would require the county to provide paid parental leave to county employees prior to the effective date of the state Family and Medical Leave Insurance Program, require the county to pay an employee's salary minus benefits under the State Family and Medical Leave Insurance Program for certain leave taken under the State Family and Medical Leave Insurance Program, and generally amend personnel and human resources laws affecting county employees. There were a couple of conversations. It was a particular amendment that I put forth to include parents of stillborn babies in this particular bill, which was adopted. But given that Councilmember Friedson was the lead sponsor of this bill. He basically led most of the conversations. I'm going to turn it over to him to kind of like wrap up everything else, and then if Ms. Wellens has anything else in particular, she can do that as well. But I think it was pretty straightforward, and the council they've all supported this very critical and very important bill. Councilmember Friedson.
Well, thank you so much, Madam Chair. Thank you to colleagues. Really pleased that we are at this moment. A lot of work went in, a lot of collaboration with stakeholders, with the executive branch, which I appreciate. I'll have some closing comments if that's okay. I think we have a couple clarifications. There was an addendum to the packet that I just want to make sure everybody was clear. This was part of a discussion that happened at the joint committee of an agreement. The addendum to the packet, and I'll let Ms. Wellens go into more detail if she would like, but essentially we want to make sure that the county has an opportunity to do more once the FAMLI state law is in effect. This is designed to serve as a minimum requirement, as a supplement to that effort to provide the full pay for county employees for 6 weeks for parental leave. The county, like any other employer, once that goes into effect, would have the ability to go further and do more, and to essentially waive out of the requirement under the state as an employer, and as long as the state approves that it is above and beyond what the state requirement is, that would satisfy the requirements of the bill as well. The executive branch was supportive. There was a 6-0 vote at the joint committee to support that, and it was not included in the original packet as an oversight, but was included in an addendum to make sure that we had language that allowed for that to take place. I don't know, Ms. Wellens, if you wanted to speak anything more to that. I'm happy to go through other aspects of the bill, and I just had a couple closing comments after we're done going through it, if that's okay.
I don't have anything to add. Thank you, Mr. Friedson.
Great. I don't see any other questions or comments from colleagues, so I think we can go to the roll call vote.
Mr. Katz?
Yes.
Oh, wait a minute, sorry. Councilman Friedson?
No, I apologize. I thought that Councilmember Friedson was going to continue discussion of the amendments.
Do you want me to? You can go through the amendments if you'd like.
Yeah, I apologize for the misunderstanding. So the only other two amendments that I wanted to make sure were mentioned were the clarifying amendments to clarify that parental leave taken by county employees must not count against other types of leave, and to clarify, except for FMLA leave as is specified in the state law, and then just to clarify that the employee must not be required to exhaust other leave provided for under the law prior to using the parental leave. As Councilmember Friedson noted, the addendum reflects the additional amendment that he described, and this amendment is not new. It was decided, it was fully vetted and discussed by the committee during the work session. There is, I wanted to just point out, for potential consideration of the council, on page 6 of the staff memorandum, there is a potential amendment to require further study regarding the utilization of parental leave by race and ethnicity as the program rolls out, because subsequent to the work session, council received the OLO's racial equity social justice statement, impact statement, and unfortunately the OLO noted that additional data really would be needed regarding leave utilization rates to really provide a more definitive sort of analysis of leave programs and the racial equity and social justice impacts of those programs. So just noting that for council's
Yeah, before we move on from that, I am going to move that. Staff has recommended this as a required report. I think it would be very helpful for us. We have insufficient data, which was noted both in the racial equity and social justice statement, also actually in the economic impact statement as well. Obviously, we've had a long conversation in multiple avenues just this morning, talking about the importance of data collection, how important it is for us to inform our decisions moving forward. And so I really appreciate staff putting this forward. I'm happy to move it if there's a second. But Section 3 required assessment by January 1st, 2024. The Office of Legislative Oversight must provide to the Council data which must be provided to the Office of Legislative Oversight by the Office of Human Resources in analyzable form regarding county employee parental leave usage by race, ethnicity, occupational class, and wages, and 2, a racial equity and social justice assessment of the implementation of this act, and any recommendations to improve the racial equity and social justice impact of this act based upon its implementation. So I would move that forward.
So we have a motion and a second. Now discussion. Councilmember Jawando.
Thank you, and appreciate that amendment. Definitely will support it, and appreciate the pair of bills. I look at this, and I think this amendment will feed directly into what I was going to say about the overall bill. I think it's going to give us the information. This is a great start. I think there's more, there is more we can do, both in the culture at large, in private sector, but also in county government. But this is a good floor, and it's just unconscionable that you still have today people trading and giving away leave to take care of their children. It's we have not made enough progress. So I want to thank Councilman Friedson and thank my colleagues, and I think this information will help us build upon this in future councils. Thank you, Mr. President.
Thank you. So we have a motion and a second. All those in favor of the amendment, please raise your hands. And that is unanimous among all those present and virtual. And now I need a motion to move this to roll call vote as amended.
So moved.
Moved by Councilmember Friedson, seconded by Councilmember Rice. And let's move on to the roll call.
Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Jawando?
Yes.
Mr. Jawando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
Let the record show that passed unanimously. I'll turn it back over to Councilmember Friedson to make some acknowledgments.
Yeah, I just wanted to thank, I should have done this in the outset, but Ms. Wellens and Ludine McCartney-Green for all of your work on this bill and the next bill. Selena Singleton here did quite a bit of work. The Montgomery County Commission for Women, we have Ms. Finkelstein and a number of representatives who are here who worked very hard. And then on the next bill as well, the Montgomery County Fetal Mortality Review Board and Community Action Team, the Office of Human Resources, Planned Parenthood, and McGeo. There are a lot of people who participated in the crafting and working through of this legislation. And so I wanted to make sure that we took the opportunity to acknowledge them, those who are here, those who are watching virtually. We really appreciate it, and also the collaboration with the executive branch, which we worked through this together and agree that these are not intended to be the end, but the minimum standard that we hold ourselves to as a model as an employer for what we think should be a basic threshold, not a ceiling but a floor. So I'll yield back to you, Mr. President.
Thank you. So that bill passes unanimously, and we move on to the next bill, which is Bill 1122, Buildings, Lactation Rooms, and County Buildings Required. Once again, there was a joint Government Operations and HHS Committee work session that recommends enactment. I'll turn it over to the chair of the GO Committee to talk about this bill as well.
Thank you so much. And as you just stated, Mr. President, there was a joint committee session, and we did recommend unanimously to adopt this bill. It will require county buildings to include a lactation room for county employees or provide an alternative accommodation, require employees to receive break time for lactation needs, require the county executive to establish personnel regulations for certain accommodations, and also require certain educational materials posted on the county's website, and generally amend the law regarding buildings and personnel regulations. And once again, Councilmember Friedson, who is the lead sponsor, really led us in the conversation, so I'm going to turn it over to him. And I want to thank also Ms. McCartney-Green for preparing a great packet and really helping us through this joint session as well.
Thank you very much, Madam Chair. Appreciate you noting what the bill does. I'll just note quickly the amendments that were made at committee all were unanimous. I don't think there's much disagreement, but I think it's important to note that all new construction include a sink with running water. Existing buildings would require at nearby access to running water. It would extend the implementation timeline for Department of General Services by permitting the following: 6 months after enactment, Department of General Services will have completed its assessment of all county buildings for the inclusion of a lactation room. 12 months after the bill's enactment, DGS would complete the planning, design, construction, and installation of lactation rooms in the highest occupancy buildings. It's approximately 30 buildings. And 24 months after the enactment of the bill, all other lactation rooms would be complete. It would require at 3, 9, and 21 months a report to the council on the assessment and outcome of the Department of General Services progress. An amendment to clarify what reasonable break time means, that it may not be compensated outside of normal paid breaks. Require lactation rooms to be secured or locked from the inside. That was those are more of technical amendments just to clarify the language that was used, and then require a method for the Office of Human Resources to communicate the location and availability of lactation room. And I'll note that Councilmember Rice had suggested the possibility and availability of taking advantage of the Ignite Hub and some of the really incredible innovative work that is happening there, and really making sure that this is part of some of the other efforts that we have undertaken. And so that was an important conversation and discussion that we had in the joint committee session. I think that covers Ms. McCartney Green.
Well said, Councilmember Friedson. I think you've covered all the amendments that we discussed during the joint work session.
Fantastic. Well, I appreciate it. I think with that, I'll just note how proud I am that we're moving this forward as well. In many ways, it was a companion bill to the other measure that we just passed, and it's really part of county government as a large employer, really trying to model the type of family-friendly policies that we should be implementing. This should be a place that not just serves families in the community, but is supportive of families who work to provide those services. I think both of these efforts will help us retain and attract great talent that we need, and it will also allow us to provide better services to our residents. So I just really appreciate the fact that this is just the latest in a series of efforts that this council and the previous council have undertaken along these efforts. And I've already noted many of the people who are in the audience for both bills, so I won't note again, but I just want to appreciate again the work with the executive branch. We created what I think are reasonable but very specific and measurable targets for when this work is going to be done, and all of the internal and external stakeholder groups that we work with in order to move this forward. So with that, I'll yield back to you, Mr. President.
Thank you very much for everyone that worked on this. So we have a joint committee recommendation and no further amendments on this one, so we can go straight to the roll call vote.
Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Duando?
Yes.
Mr. Duando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Hooker?
Yes.
Mr. Hooker votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
So let the record show Bill 1122 also passes unanimously. Thank you again to everybody who worked hard on that one. We now move on to item number D, which is Bill 1422, Police Private Security Camera Incentive Program. Public Safety Committee met yesterday and recommends enactment with amendments. I'll turn it over to the chair of the Public Safety Committee, who I'm sure will turn it over to the lead sponsor of this bill, but Chair Katz.
Thank you very much, Mr. President. And yes, you did predict. I am going to turn it over to our friend, Councilmember Rice, who had a little bit to say about it yesterday as well, but let's turn it over to him. Thank you.
Well, thank you very much, Mr. President and Mr. Chair. There's been a lot that's been said in the community about this bill, so let me just dispel the myths and make sure that everybody understands where this bill came from. When I first met with Alexis Jones, the mother of Jalen Jones, who was murdered in Germantown, one of the first questions she asked was there anybody who saw anything? And was putting a call out to say, if anybody saw anything, please come forward. The second thing she said is, the police are trying to canvass the neighborhood and asking for camera footage if anybody saw anything was captured, so that they could help to see who killed her son. And it was at that point that Ms. Jones made me promise to her a number of things. And it reminded me of when I first got in office, and so this is surreal. Because when I first got in office, one of the first things that a young girl came to me and asked me about was bullying in her community, and made me promise to her that I would try and come up with a law that would affect bullying and keep other kids from being bullied like she was. We passed 2 years later one of the strongest bullying bills in the nation. And I'm very proud that I stick to my promises. And just like I promised Ms. Jones that we would do something to make sure that if something like this befell someone else in our communities, primarily communities of color, that we would have means to be able to help to solve those crimes and bring those people to justice, then that's what I would do. And that's what this bill is about. I understand that many people are speculating about the role of the police and about over-policing in neighborhoods, and those are all viable and justifiable concerns. But do keep in mind that we can't forget about the victims in our community. We can't forget about their voices and the needs that they have. We can't forget about the fact that these are people who are looking for solutions. Just as my family looked for solutions in the murder of some of my family members, it is incredibly important for us to not forget those voices. And so I appreciate all of my colleagues who have co-sponsored this legislation, but more importantly, this isn't about me. This is about people in our community who continue to want to make sure that they can be safe in their communities. That's what this is about. This is not about extending the arm of police. This is not about infringing on people's rights. This is about just making sure that people can feel as though they're a little bit safer in their communities, and if something does happen, that they can find out what happened and make sure that there's justice for them. So I really appreciate the work of the Public Safety Committee. I want to thank my staff, who also had those same tear-felt phone calls and conversations with Alexis Jones. But I just want to close by saying thank you, Ms. Jones, and now you see that I keep my promises. So back to you, Mr. Katz.
Thank you. I'll just make a couple of comments on this, and then Councilmember Jawanda would like to speak as well. One of the top issues that was of concern as I knocked on doors, as many of us on the dais have over the last year, is the increase in crime that we're seeing in communities. And that was particularly true in our more urban communities that tend to have more of our minority populations residing in them. And I was struck by several conversations I had with people who had indicated they had been living in that community for more than a generation and had never felt more unsafe than they did at the moment. So I think it's important for us to take advantage of technology as it grows to be able to address some real life problems that we are seeing on the ground right now. And I'll note that probably most of us here have these security cameras in our own homes. And I think it's appropriate for us to extend that same opportunity for other members of the community that may not be able to afford these on their own because of cost barriers. We do have to make sure, as we have been for the last 4 years, that we ensure the transparency and accountability of law enforcement. But just as we are looking at putting more of the burden on red light cameras and speed cameras rather than direct enforcement in other areas where we're taking better advantage of technology, I think this is another example that clearly has demonstrated helps officers close cases that otherwise may not be closed without this type of intervention. So we will, as a body, and have been, continuing to monitor this and all other operations within law enforcement, and have set up structures of accountability, including most recently the Police Accountability Board, which I think are going to go a long way in making sure that we make those changes. But I am sensitive to and appreciate the recommendations that were set forth, and we had with regards to the racial equity analysis, and we had, I thought, a productive conversation yesterday about this in the committee. So I continue to support this bill because I do think it is going to make a sincere and authentic difference in addressing some of the very real crime issues that are facing communities now. Councilmember Jawando.
Thank you, Mr. President. I appreciate Mr. Rice for sponsoring the bill, and I am a co-sponsor. I co-sponsored when he introduced it. I do think it's important that we remove barriers to solving crimes, and we can do that in an equitable and transparent way. And both are important, and both require work. I've spoken about this before, but another reason I think this will be helpful is we had an increase of violent crime in the downtown Silver Spring area, for example. And I convened a meeting of the nightlife owner establishments with police, which was, I couldn't believe the first time that had happened. And one of the things that came out of that meeting and subsequent conversations is that we need more lighting, and we need more access to cameras for businesses that can't afford to put them in, or to put them in different places. And you know, as a civil rights lawyer, there's a whole bunch of concerns that come up when you put cameras and surveillance. Who's doing it? How is it done? You know, who's involved in deciding where? All those things. But it still is important to have it, and that was coming directly from that business owner community as well as individuals who had been impacted by crime. So I think it's important to put it forward, but I do think we need to be careful and make sure that we do it in a methodical way that makes sure it looks at all the potential unintended consequences that come with disproportionality in everything that we experience. And it's not just like any other issue. When you have increased surveillance, and it's particularly in communities of color, you have the opportunity for potential disparities in how that information is used. And so one of the things that was recommended in the Racial Equity and Social Justice Statement that I'm going to offer an amendment to add to this bill is that a group of diverse stakeholders be convened as part of the Method 2 regulation process promulgated by the chief to consult and work with him and the department on putting out the rules of the road about how this program will be implemented. And so with that and working, I know this has moved pretty quickly. I was just talking to Councilmember Katz about that, so we can get this going. The language that, Ms. Wellens, do you want me to read it into the record? Do you want to do it?
I have it. Happy to.
Yeah,
you want to do it?
Okay, I'll do it. Yeah, not put you on the spot there. The language that I'd like to move would be that we would add, I think after line 48, if you can correct me if I'm wrong there.
This would be amending lines 41 through 43 of the committee bill.
Amending lines 41 to 43, that we would say, prior to the implementation of the program, the chief must, in consultation with stakeholders, including victims and racially and ethnically diverse residents, promulgate Method 2 regulations to implement the requirements of this section. The regulations must address, and then it will continue on. So that I think will strike a nice balance. I appreciate Councilman Rice and others for working with me on that language. I'd like to move that at this time.
Before I second, I just want to thank Councilmember Jawando again for teamwork in this and really crafting something that I think will ensure that public voice will be a part of the Method 2 regulations, which will address many of the issues that you as well as community members have highlighted. I really want to thank the NAACP as well as our Office of Racial Equity and Social Justice for highlighting some of the things that I think that we need to consider as we move forward. So I second that amendment.
All right, we have a motion and a second. All those in favor of the amendment, please raise your hands. And that is unanimous among all those present and virtual.
Thank you, Mr. President.
Great. Ms. Wellens, anything else that you wanted to highlight before we go and make a motion to go to the roll call vote?
No, thank you, Mr. President. Right, correct. Motion followed by the roll call. Thank you.
Oh, Councilmember Friedson.
Yeah, I just had to slip out to use the restroom, but I would like to be listed in the affirmative for the amendment.
Great. All right, can I get a motion to move the bill forward as amended?
So moved.
Moved by Councilmember Rice, seconded by Councilmember Katz. Let's go to the roll call vote.
Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Jawando?
Yes.
Mr. Jawando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
All right, let the record show that passes unanimously as well. Thank you, everybody who worked so hard on that important bill. Next, we move on to item number 7, which is our district council session. The first item is just an announcement that a public hearing on the sectional map amendment SMA to implement the approved and adopted Silver Spring Downtown and Adjacent Communities Plan, SMA H-146, will be held on September 20th, 2022 at 1:30 p.m. The next item is an introduction. This is a zoning text amendment, 22-08, Commercial and Residential Zones, MPDU. The lead sponsor is Councilmember Friedson. A Fed Committee work session is tentatively scheduled for September 19th, and a public hearing is scheduled for September 13th at 1:30 p.m. I'll turn it over to the lead sponsor, Councilmember Friedson, to talk about the ZTA.
I'm probably just going to turn it over to staff. This is really a technical correction, something that was raised by planning and council staff, and we're introducing it just to clarify what was the original intent of the language. I'll turn it over to our zoning attorney to explain in more detail, if she would.
Thank you, Councilmember Friedson. So this CTA will clarify that the MPDU provisions do apply in the CRN zone. So the MPDU provisions allow you to have additional height and density to build those MPDUs. In addition, it will require site plan approval for those projects.
Great. So that ZTA is now officially introduced. That moves us on to item C, which is introducing zone text amendment accessory structures use standards. The lead sponsor is Councilmember Reamer. The Fed Committee work session is tentatively scheduled for September 19th, and a public hearing is scheduled for September 13th. Councilmember Reamer, who's joining us virtually, would you like to make some comments about this?
Sure, thank you. First, can I just share with my colleagues, I tested positive for COVID, so that's why I'm virtual today. I've been isolating and will continue to do that, and so far it's not too bad. I got, being vaccinated and boosted enables your body to fight it off, that's for sure. So this is a zoning text amendment that addresses a particular issue, which is whether a person can do a pool enclosure and whether that structure counts towards the limit on the amount of accessory structures on a property. So we'll take it up at committee and look forward to working through the details. Thank you.
Thank you. And Councilmember, I know all of us are wishing you a speedy recovery and that you continue to have mild symptoms and you come back to us in one piece. So feel better, my friend. With that, Ms. Nadeau, anything else you'd like to add?
I had nothing to add for that one, other than I do believe Councilmember Hooker is a co-sponsor. I'm not sure if that was noted on the agenda, so I just wanted to add that.
Great. Let the record show Councilmember Hooker is a co-sponsor. Terrific. That is now officially introduced as well. That takes us on to the next item, which is Zone Text Amendment 22-10, Streets and Roads. The lead sponsor is myself at the request of the Planning Board. Public hearing is scheduled September 20th at 1:30. The Transportation Environment Committee work session is tentatively scheduled for October 10th. Ms. Nadeau, any comments on this?
So this ZTA is similar to the bill that was introduced during legislative session, is part of the Complete Streets package, and yeah, that's all I have for that at the moment.
Terrific. That is now officially introduced as well. That takes us on to item number E, which is Introduction Subdivision Regulation Amendment SRA 22-01, Streets and Roads. Lead sponsor is myself at the request of the Planning Board as well. Public hearing is scheduled for September 20th at 1:30, and the Transportation and Environment Committee work session is tentatively scheduled for October 10th. Ms. Nadeau?
Also part of Complete Streets.
Great. We're flying through here. Next is, this is a work session in action. This is a zoning text amendment 22-02, density and height limits parking, biohealth. Fed Committee recommends approval with amendments. I'll turn it over to Chair Reamer to describe this issue.
Great. Well, Councilmember Friedson introduced this zoning text amendment that seeks to allow more flexibility for urban life sciences projects, and it's a good proposal. We worked through details at the committee, and in a moment we can turn it to Councilmember Friedson to share his comments and then go to council staff to walk through. I do want to highlight, we talked about at committee one additional issue, and I think we've achieved agreement on that, so we'll make a motion to add a specific component to this zoning text amendment to allow facilities in moderate industrial areas. So I'm going to now pass it back to you, Mr. Council President, for Councilmember Friedson and the staff.
Thank you very much. Councilmember Friedson.
Yes, I appreciate it. First of all, thanks to colleagues on the Planning, Housing, Economic Development Committee. Thanks to Ms. Nadeau for a tremendous amount of work. Thank you to my Chief of Staff, Cindy Gibson. We all have gone through a considerable amount of work with the Planning Department and with stakeholders and with staff to arrive at what I think is a really good outcome here. And this is part of this council's continued effort to double down on what is one of our top strengths in Montgomery County, biohealth innovation. When we talk about how Montgomery County is going to move towards the future coming out of this pandemic and how we utilize the assets that we have, the investments that we've made, the commitment that we've had over the last many years, last couple decades, frankly. This is one of those examples. There was just recently a report that Montgomery County is #2 in life sciences talent in the world. This is an incredible achievement for us, and we have to really be intentional about how we utilize that talent and make sure that there are opportunities for companies to invest, for people to utilize that talent to create life-saving, life-changing technology and innovation. What this particular bill does is just makes it a little bit easier to do urban bio. The really top biohealth sectors have both suburban bio, which Montgomery County has always done extraordinarily well, and opportunities for urban bio as well. We're seeing added interest in both, and we're trying to make sure that we have a zoning code that is adaptable to the growing needs of the diversity of buildings and labs and types that we see, that we know that there's interest in, and we know Montgomery County can lead on. And so this is directly tied to the economic development strategic plan that we've passed in terms of being intentional here. This is part of our ongoing efforts, and I'm just really pleased that we've been able to get to a consensus. And you heard Chair Reamer note his interest in, while we've significantly targeted this zoning text amendment to make sure that it focused on the areas that we most wanted to address, Chair Reamer has worked on what I think is a thoughtful and modest proposal that's talked at length in the packet. I'm happy to second that at the appropriate time when he puts that forward. Just wanted to note my support and appreciation for that. And if it's okay with you, either you can or I can turn to Ms. Nadeau. Thanks, Mr. President.
So this ZTA has had a few amendments since it was introduced that were all recommended by the Fed Committee. A quick overview of them: it removed some of the provisions about biohealth priority campuses. It will require the adaptive buildings public benefit points, and also limiting to properties along major roads. The biggest change is how height is going to be calculated. So bear with me, there's going to be quite a bit of math here. So the way the amendment is drafted, you will get a 1.5 times your height multiplier for buildings that are under 100 feet. In addition, there will be a height averaging system. So the way that will work is if you either have one building or multiple buildings, you can average your height so that the biohealth industries can get the additional height they need for all their equipment while not increasing the bulk too much. So for example, if you had a building that was mapped at 150 feet, you could have one portion at 175 and one at 125. So the overall bulk and effect on the neighborhood isn't too much, but they can still do what they need to do within the building itself. And in addition to that, you can use either the multiplier or the height averaging or both, because if you do both, you get a marginal increase than you would using one alone. So that is the major amendments so far. I don't know if you want to pass it off to Councilmember Reamer to introduce the next amendment, or I could go over it.
Councilmember Reamer.
Thank you. Appreciate that. Well, we have been contacted by a company that is seeking to retrofit and build a life sciences facility in a industrial area. It's really an area that already has office uses off of Goody Drive, and the need is for a little bit additional accommodation to allow for some of the equipment, for that heavy equipment that's used in lab space and things like that. These uses are already allowed in the industrial zones. So we thought carefully about to what extent would we be changing what could happen in industrial zones, and if we thought we were changing that a lot, we would be really cautious about it. However, it doesn't seem as though it would have a significant impact generally on the appeal of doing a project in the industrial zone. And this will allow us to get the benefit of a additional significant project, and perhaps there'll be other locations where this can happen as well, and continue to support the growth of our life sciences sector. So I'd like to ask Levu to take the details. I'm a little going on a sleepless night here, but we had some careful discussion about it, and Ms. Nadeau laid it all out for us in a draft amendment that I'd like to move at the appropriate time.
All right, we have a motion on the floor. Is there a second?
Second.
Seconded by Councilmember Friedson. Any discussion? Councilmember Joando.
Thank you. Yeah, we talked about this in committee. Just, Mr. Nadeau, just give me the sense, and if his planning needs the help, I know I see Jason here, Satori here. What's the sense, what's the scale of what would be included here, and how many of these IL, or IM, I'm now confused now. Yes, there we go. How many of these zones are there, and what would the impact of this be as far as versus other industrial zones? And I know that's in the packet, but could you just, for the millions watching at home, if you could illuminate that?
So one thing about the ZTA is it was already limited to red policy areas and being near transit. So if you go to, I think it's Circle 33, but I worked with planning to pull up a map, and there are basically, so the amendment that Councilmember Reamer is proposing is just the IM zone. So there's three major IM areas that would be impacted. There's the Clarksburg Special Study Area, the Krabs Branch Goody area, and then the county transfer dump site. So those are the three parts of the county that would be affected by adding in the moderate industrial zones.
Right, and so the red area, so on page 6, you've got the whole red area, which would be eligible, and then within that, you've highlighted in blue here, looks like the IM zones and the IL zones, correct? And then how many more of those, I'm trying to get a sense of the delta between what are those zones that are outside of the red policy area, how many exist in aggregate?
So there's not that many, honestly. Industrial area is pretty limited and precious. That's part of why the amendment is limited to just the IM zones. I think it's either the page before or the page after. There is a map of all the industrial area in the county. So compared to all the area we have, the part that the ZTA will affect is pretty small, especially because most likely you're not going to get one of these projects in that Clarksburg Special Study Area because we save our farm agricultural up there. And then the county transfer dump site is probably also not a spot that these will be built. So it'll mostly affect that Krabs Branch Goody area.
Got it. So scalpel, not a hacksaw.
Exactly.
And if someone needs to go up, we want to allow it. And okay, so I just think it's important to talk about that because the industrial area is important because we don't have a ton of it, and we want to make sure it remains relatively affordable, which is you lay out very well in the packet. So thank you. I appreciate that.
Great, and just an observation, Ms. Nadeau, you are very good at explaining very complex information in a way that people can process, especially me. So thank you very much for that. So we have a motion and a second on the floor. I see no more discussion. All those in favor, please raise your hands. And that is unanimous among all those present and virtual. So that is, are there any other amendments we need to discuss? Okay, so we can now, can I get a motion to accept this ZTA as amended?
So moved.
Second.
Moved by Councilmember Friedson, seconded by Councilmember Jawando, and this is a roll call vote.
Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Dewando?
Yes.
Mr. Dewando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
All right, let the record show that passes unanimously as well. Thank you, everybody who worked on that, too. We now move on to the next item on the agenda, which is our consent calendar. There are a number of items on the consent calendar. Can I get a motion to accept the consent calendar? Moved by Councilmember Navarro, seconded by Council Vice President Glass. Is there any discussion regarding the consent calendar? Seeing no discussion, all those in favor of the voting for the consent calendar, please raise your hands. That is
Aye.
unanimous among all those present and virtual. And let me just confirm. Yes, that is it for this morning's session. We will now go on to recess. We will come back at 1 o'clock for some presentations, and then we will begin our public hearings at 1:30. And there are 18 public hearings this afternoon, and so we will be here for a while. Thank you all very much, and with that, we are in recess.
Father here, Jeff, he was a star at Watertown High in Watertown, Mass. And this